Today is Monday, August 2nd, 2021, and the school committee will start with the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Agenda item number 2 are school committee member introductions.
Karen Paquette, Assistant Superintendent.
Bruce Damon, Ward 1.
Is that on? Yeah. Janet Bowden, Ward 2.
Karen Maduris Collins, my pronouns are he, him, Ward 3.
Jake Lang, the superintendent.
Megan Parks at large.
Tanya Whitlow, Ward 4.
Linnea Hawkins, Ward 5.
Ron Podvin, Ward 6.
Paul Blunt, Ward 7.
Alicia Ray, City Council Representative.
Thank you. Agenda item number 3 is the consent agenda. Are there any items on the consent agenda that any members would like set aside? Seeing none, the consent agenda is adopted. Agenda item number 4 is public input. Members of the public may address the school committee for up to 3 minutes on non-agenda items now or on agenda items later. Comments that pertain to staff, personal matters, or a student issue should be directed to the superintendent or the appropriate staff member of Lewiston Public Schools. Public comments shall be directed to the school committee and be brief, not repetitive, and related to the matter at hand. Before starting, please state your name, address, and affiliation to Lewiston Public Schools. Are there any members of the public present that would like to speak on a non-agenda item? Are there any attendees online? Oh, sorry. Yes, please. Yes, thank you.
Hi, my name's Dr. Lori Banks. I'm at 63 Franklin Street, and I'm a Geiger parent. I also happen to be a microbiology professor here in Lewiston, and wanted to speak on behalf of, I guess it's sort of pending policy about what we're looking forward to in the coming school year about whether students should be in person versus remote and whether they should be wearing masks.
I don't want to interrupt, but so right now is just for non-agenda items, and that's going to be an agenda item. So if you want to come back up and discuss it when that's the agenda.
That's fine.
Okay, sorry, thank you. Are there any members online that wanted to speak on non-agenda items? Okay. Then we will continue on to agenda item number 5, which is to receive and approve the return to school COVID recommendations. Superintendent Langlis will present.
So I shared with our community back a couple weeks ago, or close to a couple weeks ago, my thinking around going back to school. And this is a heavy topic, obviously. And in the work to come up with a recommendation, I thought long and hard and talked to a lot of people, worked with our response team, shared thoughts with the LEA, talked about it with our management team, and really tried to follow as much of the changing news, the changing guidelines, and the updates that are happening almost before our eyes, up to and including we had some new language available today for reopening. It didn't shift other language, but I think it's a pretty well put together piece. And so ultimately, I think that it's important to note that this is a very difficult decision. And there's a lot of strong opinions and theories and science and wants and wishes around it. So I'm going to go through the memo that I shared with all of you, just so that everyone has an opportunity to hear it. But in the mix of that, I also want to share afterwards, and maybe during if it fits, other perspectives that I've received since I've shared this publicly to try to capture as full of a picture as we can. And I'll start with saying that I've weighed all of those items carefully. I know that this committee would be receptive to me changing my recommendation if that's what needed to happen before this evening. I just want to be clear that I have listened to people. I have emailed back and forth. I have had face-to-face conversations. I've had a lot of input and not an easy recommendation to make, but I remain in this direction from a recommendation standpoint. So I apologize if it's a bit like I'm reading, because I will be. But as we continue to monitor the shifting advisories, news, stories, and other locally available information, it's time to bring a recommendation for opening schools before you for a vote. There are many ways to view the approach to the start of the school year. Before I share the highlights of my recommendation, I'd like to share that I've given much thought to science, what is right, the rights of individuals, and more. I've paired that with what I see. I went for a drive recently and I didn't jog, it jogged my memory of recent events, spaces, and how I perceive people are living their lives. And the truth is, what I see, people are living their lives in various ways. They're living as they choose for themselves and their families, vaccinated or not. There are few, if any, masks being worn in stores, at facilities, at parks, at home, on fields, in gyms, or in summer school, to name some. And I'd add a note that we had, I don't have an exact number, but near 1,000 students attending summer school who have not had a mask on since June 30th. With the Delta variant that has progressed, and I don't believe that it's done, which we still have to consider. We've had no instances of COVID-19 this summer connected to our summer school or being in person at all levels except for the high school. They're living as they choose for themselves and their families. Vaccinated or not, there are few, if any, masks being worn in all these spaces. There are spaces that still require masks, but it seems they are few and far between and based on personal or organizational preferences rather than requirements. I've been an advocate for vaccinations, and I know that's not popular with everyone, and I'll continue to do so. However, I do not carry the, the authority to, nor do I want to, make medical decisions for individuals and their families. I'll leave that debate to others. And I want to add here some things that progressed from Friday to today. Pretty large effort to promote vaccinations at the Auburn Mall this Friday and Saturday. This is a political, not political, excuse me, a public plug, not a political one, a public plug that numerous organizations have come together to get supplies for students, backpacks, pencils, pens, notebooks, you name it. Other community supports and just healthy approach to life, everything from employment to housing help. You name it, they've pulled a lot of resources to be at the Auburn Mall for these events. We as Lewiston Public Schools have offered up and are working to coordinate opportunities if families want to be vaccinated by choice and they don't have access to transportation to do so. We're going to try to help facilitate that on Friday. So the effort to vaccinate remains. But again, that is a family choice. I put in bold on my letter that the primary goal is to be in person full-time. What we know about teaching and learning and all the challenges that exist, there is no substitute for what a teacher can do with our kids in person. No substitute. I remain committed to the law, the requirements, and the expectations of the Department of Education. I pledge to do all I can to uphold laws, regulations, and statutes. And here are the highlights of my recommendation. That mask wearing be optional at school as a personal or family decision. We do recommend that you wear a mask if you are unvaccinated. Well, there's new talk now that maybe you should wear a mask either way, but not required. There's some recommendations. Mask wearing is required on buses, but we're getting an interpretation on that language because the language I've seen as of late says that you must wear a mask on buses as contributing to public transportation. And there's a debate right now amongst different groupings that a school bus is not actually public transportation. And I just want to make sure that that's accurate before I say anything else. For example, if a school bus is going by you and it stops to pick up children, you can't just get on and ride the bus to wherever you choose. And so I don't want to play semantics with that. I want to get it right and make sure that it's there. But my initial read of it is that masking will be required, but I want to make sure we have the right language. Staff will continue to establish routines with Google Classroom and/or Seesaw, and I put as appropriate by grade level because different groupings use different tools. But this will allow for students to have access to learning if they are in need of quarantine or if there are school interruptions. Students must attend in person. The state has some remote learning opportunities, and we're trying to get those all together for people, depending on tonight's recommendation and vote, or ultimate vote. We want to do what we can to make sure folks who have some challenges around that have some resources. But I want to be upfront. As of this afternoon, when I talked to the HR director, Kim Brown, we have 167 currently unfilled positions. We will not have the ability to provide remote learning to our students. Also in here, I have that LMS is trying to continue with the remote cohort that went really well last year and supported by this committee. But again, we're struggling to hire to fill our classrooms. So we're working on that. It's not a guarantee. Contact tracing will continue. There are some rules that have been shifted, if you will, connected to pooled testing and follow-up by next now testing. And the language as I read it currently is if you're participating in pooled testing, and there's some other little caveats, like if you tested positive within the last 90 days, you actually don't pool test. I'm still working on all the caveats with our response team, but there's a level of thinking that if you're participating in pooled testing, and even if that sample tests positive, you're considered to be monitored. So you can by next test following that. And then if you continue with the pooled testing, you're actually allowed to stay in school. And so we're working on those details. Testing is a real tool for us this year if we go with this approach, or if we shift the approach. Testing is a real tool. Those vaccinated at this point in time, in the language of the state issued standard operating procedure and the frequently asked questions, would not need to quarantine. That language could shift because the standard operating procedure is dated May, and there's other testing guidelines dated early June, mid-June. Again, just that bullet that will not be able to provide remote learning for quarantine situations. And I'm saying that as a point of emphasis. Doesn't mean if someone has to quarantine that we just forget about them. But the idea that, okay, my student has to quarantine so they can just log on and be in the classroom or with the teacher or have that interface. We can't guarantee that. When teachers are at full capacity and they have a classroom full of students, if this is what's adopted, that will take all of their attention. And so we might have to, well, we would have to revert, as I mentioned in the memo, kind of like having the flu in years past. So if you're going to be out of school for 10 days, you can request work, you can go to your Google Classroom and get work, you can check Seesaw. We use communication tools to let people know what's there, and students can access and submit things using those tools. But again, I want to be upfront and tell people that if your student needs to quarantine, there is no teacher designated to teaching and learning for that period of time, other than the teacher you have, and that will be using electronic means, not that interaction like we had last year in a hybrid model. We'll use local information in our COVID response team to inform determinations to adjust our approach, and that may include changing masking requirements, pooled testing, and I put in here maybe fuller. Intermittent. We're working with the organization that provides pool testing. And so I would prefer it being full. I think that's the right mitigation strategy in this. The reason I put intermittent, we're still working on some details, and I don't know the volume compared to our enrollment that we'll be able to access. The latest as of end of last week is that they can service a district of this size. So we look forward to that. Remote days, if warranted, I think this would be more in an extreme sense, but if we do have upticks in positivity rates or signs and symptoms, and we'll be working with our local medical partners and community data to monitor that, it may warrant remote days. I just wanted people to know that's a possibility. I put modified lunch plans. We actually had a good question today from a community member. What does that mean? And really what that refers to is we've learned some things through COVID and the hybrid model, where teachers actually found that having students in certain pockets, not everywhere, in certain pockets, having students in the classroom to have lunch was a good opportunity for kids to develop social strategies in not such a busy area, but also building relationships with their teachers and the staff around. Facilities has talked about it as a different level of strain on custodial staff because they have to go take care of those things. We try to mitigate that with not so much milk being dumped in a trash can and things of that nature where we can. But in other spaces, like middle and high school predominantly, having lunch in the cafeteria is seemingly beneficial for so many reasons that those leadership teams and that administration or those administrations have recommended moving forward with lunch as they had prior to COVID. These plans will vary school by school, and we're trusting in the leadership teams and the administration of each school to say what worked best for them for that. We'll maintain the availability of masks, hand sanitizer, and cleaning routines, continue to promote screening before attending school, and continue to symptom monitor. And I put a bullet in here to emphasis on families and students to symptom monitor. It is absolutely critical. If you have symptoms connected to that list, and we'll push it back out repeatedly, you should stay home and you should contact the nurse to say you have a symptom and we can guide you on the next steps. And that's critical because it allows everyone to stay more safe. And so we want to mitigate that where we can. And when we talked earlier about those remote days that are potential, that can really happen if we have a big number of staff that have been impacted and for whatever reason are unavailable. Because we can talk about mitigation strategies, we can talk about vaccines, optional masks, we can talk about pool testing. If someone's sick, they're not available. And so we need to be mindful of that. Continue to quarantine as criteria is met, which again, with the pool testing, there's some mitigation options there because it's being monitored. And we'll follow the authorization from DHHS, which was new fairly recently, to collect and report vaccination status as required. And I put in here, this is new and we're sorting out how we will facilitate this. And I will say to you honestly, right in this very moment, I'm still not clear on how that will work. I know that between the start of the month and the 10th of the month, we have to fulfill a template that's available from the state and submit it. How we acquire that information, how that shifts month to month, I don't have all of those answers. We're still trying to figure that out. One question I did have answered that was that because it is DHHS authorized, there's statute around that we do need to continue to do that. So that's not an optional thing at the local level. We'll follow any new guidelines that are required, and they're changing on the daily, it feels like, the different language. This includes changes in federal, state, CDC, and Department of Education as appropriate. I monitor this stuff like crazy right now. I go home and read. I get up in the morning and I read, and I'm just trying to follow all of the shifts and the changes. I'm not blind to the Delta variant. I think that it's real. I think that people can get sick. And I think that that is a level of risk that we're aware of. And that's one of the reasons this recommendation is very challenging. Any new or updated guidelines considered a recommendation by these authorities may not always constitute a change in our existing procedures. Of course, ultimately, the school committee sets policy. And so I'm making a recommendation. And part of what I'd like to do is have a framework that allows, kind of like last year, for me to make decisions in the moment without calling a meeting that allow us to navigate things and keep people as safe as we can with the information we have on the ground. But I also want people to know that if a policy is decided upon for how we're going to approach school, a new set of recommendations that come out, if we see things required, mandated, things of that nature, we will do that. If we do not, depending on the decision of this committee tonight, if it says things like recommend, should, could, may, it doesn't mean that we will. And I know that's a thin line, but I want to be upfront with people. And we will do what is required on respective jurisdictions, and education policy is determined by all of you. And what I mean by respective jurisdictions is we get into this conundrum of last year we had some that wanted us to follow the CDC guidelines, but it was the state of Maine. And then this year we have some that want us to follow state of Maine when they say follow the CDC federal guidelines. And last fall, they were very clear. It's the Maine CDC that's driving this, and DOE had language around required. And so those components have been a bit of a moving target. But as it stands right now, so everyone is fully aware, the Maine Department of Education has said we will follow suit of the federal CDC. So if you see shifts in federal CDC, unless the main language changes, that's our driving conversation. And with these highlights, I think a lot of people will be asking, what does school look like when we return to school? We need to symptom monitor. That's critical again. If you have symptoms, stay home. If you take a bus, as of right now, you wear a mask unless otherwise specified. We sanitize and wash our hands and practice good hygiene. We do our best to maintain spacing between people while knowing it's a learning environment. Lunch looks like lunch in some modified version. PE looks like PE, but again, we'll try to space. Recess will look like recess, although last year it looked close to recess, minus some podding and some rotations and masking, and the things that people use and then rotate it out. And in my hopes, and I want everyone to be safe and healthy, that a school day feels more like a school day for kids. And we will remain vigilant with any changes to requirements and adjust accordingly. That's the end of my memo. A couple other comments I would like to make, because I've heard from many people in our community, and I highly respect them for their thoughts and their inputs. I want to share that we are not blind to the fact that we have immunodeficient kids and adults and family members where kids live, that we have people who have individualized concerns, some who want to be remote not because of an condition, but they're just saying, hey, what's one more year? It worked well for my student last year. I want to do it again. And unfortunately, we don't have the resources to offer that if we go this direction. I'd be naive to say that there's not conflicting points of view on this. But I'll also say we'll remain committed with trying to get people vaccinated. The pool testing things are in motion on the way to help mitigate things. And I think with that, I'll just open up to questions that the committee may have and others.
Right, we'll open it up for a school committee discussion first, and then we'll go to the public. And I just want a reminder, in order to help control the amount of discussion on this conversation that's going to be very heavy, we're going to make sure that all school committee members get a chance to speak once first before we go back and have a person speak a second time. So I just want to tell everybody that ahead of time in case they want to wait and speak after other people speak. I'm sorry, can you turn your mic on?
Just clarification for the purposes of how we're going to do this process. And I think it makes sense to try to make sure that there's balanced speaking. Should, in terms of consideration of amendments to this proposal, should we be waiting until after the public speaks for that, or do we do that beforehand?
I think from my perspective, I think we should hear everybody's input first, but obviously people are entitled to do what they'd like.
That seems reasonable. I just wanted to make sure that we're flagging that for after the public discussion.
Ms. Whitlow, did you have your hand up?
I did. So I guess the recommendations, no matter what we decide about the masks or what, we are planning to go back full time with classes full. So I guess if things are changing so rapidly, I question why we feel we need to make a decision today. And so I want to keep that kind of open, that if we know that kids are going to be in school full time, can we make the decision about masks closer to when school starts? I guess I just want to.
It certainly can be decided later. I think the basic constructs of this would be helpful to have sooner than later, so parents know what their kids are going into, so they can condition them. I'd also say for our staff, so they can condition themselves in their classrooms and their spaces, our facility staff, to make sure we have the quantity of things we'll need in which places and the volume. But I would advocate for a sooner decision that could be adjusted over a decision that waited, because I think people they want to know. And I think that's just where they're at right now.
Any other discussion? Mr. Putman?
So Jake, moving forward, and I reflect on our experience of the last year, and going into this situation with so many unknowns, I think from my perspective, I want to do what's right that has the least amount of possibility of failure. And there's a couple things you mentioned there that kind of red flagged me a little bit. And one is resourcing, that we have so many open positions already. I know I've already talked to you about special ed this summer and some of the gaps that happened. I guess what my first question is, what is it when we have an IEP for special ed and there's a requirement that certain things happen, and for either COVID reasons or for staffing reasons or programming reasons, it doesn't happen? How do we reconcile that with the student and the parents moving forward? Because I really fear about gaps in the delivery, and as we go forward, I can't believe we're not going to experience classrooms shutting down and quarantining, schools possibly shutting down again with this variant that is 2-3 times as bad as the original. So, I'm trying to grasp it in terms of what this is going to look like. How do we address when we can't provide something?
I'll do my best to answer your question, but the truth is there are some gaps. One of the challenges we have around certain services like, say, occupational therapy in the summer, if that's on a student's IEP. Our occupational therapists have currently a schedule or a contract that is the school year, and not for summer, like our other folks do. And there's a harsh reality that some can get upwards of $75, $85 an hour working privately in the summer. And we just can't compete with that number. So some positions go unfilled, especially over the summer. And because they go unfilled, we don't have the means to provide the service. As you know, we was not pleased to find out about that situation. And we're working to rectify it by continuing services, even though summer is done. But if we don't have qualified staff available, we can't provide something we don't have the staff to do. When we don't have that internally, we look at outsourcing. We look at contracted services, other organizations. And right now, the shortage is real across the board. It's not a Lewiston problem. I would say it's a state, if not national problem. The amount of people that we need in education that we struggle to get.
Were you done, Ron?
Just quick follow-up. So to the parents, what you're saying is there may be a potential we can't provide what we should provide. And what's the vision that parents should have in terms of what their remedy is if that does happen with the Lewiston School Department? I mean, do we get a waiver from the state that, hey, we're in crisis, we can't do it? Do we have level of responsibilities that we still have to follow through with? I think parents are just kind of nervous right now, what to expect and where to go. So I don't know if you have the answer now, or you can work on it and have some sort of an answer for them.
I think the biggest challenge that you're referencing is about the summer. Those folks typically come back to work in the fall, and they do work their contract with us. But once their contract is complete, we don't own them. They can do other things, or just have their time off as they have earned by contract. So I do anticipate that once we're back in school, those services will improve. But we remain to struggle to hire specialty areas, things like physical therapy, occupational therapy, speech therapy. Those people in Maine anyway are few and far between. We've even contracted with external sources that are outside of our entire region to work to connect the dots. So we're committed to the effort, but we don't have if we don't have the staff, we will continue to struggle to provide those services. The language, if you will, my understanding in special ed law is that we have to do everything that we can.
Any other board members like to speak? Member Madras Collins.
So to start with, the central question that faces us is whether we should continue a schooling approach like we saw last year, or whether we should go back to full attendance 5 days a week. I support going back to full attendance 5 days a week. And so as we broadly aim for that goal, we have to consider what the risks are with that and what the inequities are with that. And one of the things that jumps out to me about this proposal is how profoundly unfair it is to people who are acting responsibly, who are doing nothing wrong, and who are yet being put in a situation where their children who are too young yet to be vaccinated are going to school with other unvaccinated children who aren't being asked to wear masks, are going to school with staff members who may not be vaccinated, who are not asked to wear masks. That strikes me as a profound injustice for our youngest students and for parents who are interested in ensuring that their students are safe. And compounding on that injustice is the fact that we have asked them to do that and then taken away their option to have their students learn remotely. Last year, when parents were concerned about their children's safety, they had an alternative option. They were able to have their students learn at home and learn remotely. But that option has been yanked away in this proposal at the same time as all of our mitigation and safety mechanisms have been shredded. So all told, the proposal that's in front of us is irresponsible and dangerous. I think that the fundamental goal of getting children back to school 5 days a week is a good one, and that we should pursue it. And I don't even really blame anybody who doesn't want to wear a mask. I'm very glad not to be wearing this right now because I'm vaccinated and because our county is in a safe enough position according to federal guidelines that we don't have to wear masks indoors. If that changes, I'll put it back on. And I hope that my colleagues would too. But nobody on this board is a public health expert. Nobody on this board is a doctor. And we need to listen to the folks who know what they're talking about. The federal CDC recommendations say that there ought to be universal masking in schools. And to see in this proposal that not only are we not requiring that vaccinated students be masked or vaccinated staff members be masked, we're not even requiring that unvaccinated students and staff be masked. So this is baffling to me because I have been so appreciative. I haven't always agreed with everything that the superintendent has put forward, but I have understood a lot of the logic behind it, even when I didn't agree. And this is just such a radical departure from how we approach things for the last year. I think that we have to reflect on the fact that one of the reasons that we were able to keep schools relatively safe last year, and I say relatively because kids at school who were getting the virus and quarantining, having to shut down schools, and we did that, but relatively safe, is because we took all kinds of precautions. And now at a time when we have the most dangerous version of this virus circulating, and states in this country are hitting all-time highs that they've ever hit, the suggestion that we're just going to throw all of that out the window, to shred it and to act like everything is normal is absurd. And this district and this community and this committee will live or not to regret it.
Member Bowden.
Yeah.
Thank you. First of all, Jake, I just want to thank you for such a well thought out letter and recommendation to us. I can tell you've put a lot of time into this and a lot of research, and I really appreciate the work that you put into this proposal. I also want to thank the members of the public who emailed us with their thoughts and their concerns. As a new board member, I really I took this position, and I really want to be the person that listens, like really listens to everyone to try to gain a new perspective instead of just put my walls up and try to fight for my own point of view. With that said, I've done a lot of research myself, and I have some facts that I want to share because that's kind of the direction that I'm going to be voting. I'm going to be voting on what I see as fact. I don't like playing what if games. I just feel like you could play those all day. So the number one fact is that we are no longer under a state of emergency. We have been dealing with coronavirus for 1.5 years now. We know a lot more today than we knew when it first started. One of the things that we do know for sure are that 0 students died in Lewiston Public Schools last school year from COVID. And as far as my research shows, 0 students are dealing with any sort of serious life-threatening injuries in response to COVID from last year. The CDC did recommend face coverings, but they did not mandate them. I don't believe we as a board have a right to tell parents that in order for their children to attend public school in person, that they need to wear a mask every day. Again, it's not a mandate. Community transmission at the moment is extremely low. Positivity rates are low. And as we've already learned, children just are not at serious risk from COVID. And I think probably my most important point, and I really hope everyone's listening to this because this like really drives it home. I think it's important that we protect the ability of parents to make decisions for their children. I just don't think that we should be dictating this. So I appreciate your recommendation and I'll be voting in favor of it. Thank you.
Ms. Ray.
Can I ask a question now and make a comment after we hear from the public? Is that okay? So Superintendent Langlois, can you just tell us again a little bit more detail about pooled testing and what that does? It's not preventative in measure, it's measuring if folks have it, right?
So the word that keeps coming up as I research and look into pool testing, which we have in motion, is monitoring. Because you're right, it's not, doesn't do anything to prevent the spread of COVID. It doesn't do anything to mitigate it if it exists in that space. But because it does allow for monitoring and then followed up individualized testing, it has been put forth that it is a strategy that, or a tool, if you will, that we can use. And then the way that works, if I may just say a little more, just for folks wondering, pool testing is where you can take a swab and give it to a student and staff, and they unwrap it themselves. They do a swab on in the nose, but not, way up in where they're poking the brain like it felt like I had a couple of times. But it's a PCR test. But the difference between pool testing and a single test is that you put as many of these things up to 25 or maybe 35 in a canister, and they test that one sample. So it's easier for the labs. It allows for a really accurate PCR test, which is considered, I think the language I saw recently was the gold standard in COVID-19 or COVID testing. So it's really accurate to a very specific level. You're not dealing with a lot of false positives, things of that nature. So if the pool testing happens, you're looking at weekly. And so we'd have a rotation in our schools that any sampling of students would be pool tested weekly. And those results come back usually in a 24 to 36 hour window, what I'm told. And if you have a positive, which according to some of the data that came out of places in Massachusetts was like 1 out of every 130, don't quote me on the number, that there was a positive test. It allows you to use the Bidex Now test to immediately test anybody in that sample to see if you have a continuing positive, if it was something else. But with the pool testing, it allows you to mitigate quarantine situations and actively monitor the student population and adults if they wish on a continuous basis. So it can mitigate being close contacts and having to quarantine. You might be closely watched with your pool testing if your group tests positive, but it doesn't just automatically mean you have to go home. We're still working out some of those details because we're in that sign-in phase, but that's my understanding of it. And we have talked with our COVID response team, and I've spoken to Wendy Burgoyne, who I've learned to trust a great deal in this process, in this whole pandemic. She's been great, and we're going to know all of the rules and navigate it and make sure we do it well. There are also outside supports that can help you facilitate and administer the test, and the state emergency funds pay for the tests, the kits, transportation of them, and the communication around them. So that's helpful. So more than you asked, but I guess I wanted to say that publicly so people know what pool testing is, but it's a swab, and you do it yourself and you put it in a container without touching it, and then it gets sealed and sent.
I appreciate that in-depth explanation. I think a lot of people have just been like, oh yeah, pool testing, but haven't really gotten an explanation for what that looks like. My other question was just, so I personally chose to stay out of the classroom for this past year until I was fully vaccinated and school is already out. So unfortunate there, but I'm just trying to understand the reality of what spacing in the classroom will look like in the fall. I think I personally, the one piece I will share is that I want to be in person full time, everyone at the same time. And so what does that look like in the classroom? Are there other kind of sore spots for that?
Yeah, so my summary of spacing right now, at least from all the language I can interpret and think through, is that you want to maintain 3 to 6 feet wherever you can, while knowing that teaching and learning is the priority in person. And so what that means to me is spacing will be a very difficult thing to have, especially when we're at full capacity with our enrollments. But all of the levels of recommendation that we have seen include being in school, in full, in person, while knowing they're well aware we will not be able to follow spacing guidelines. So it's kind of recommended to do what you can where you can, but notwithstanding the fact that we have physical limitations with the size of our enrollment.
Any other discussion before we go to the public? I think we should wait. Are there any members of the public here in person that would like to speak? Please go to the podium. Thank you. We're going to follow the same 3-minute guidelines as public comment. If you can just identify yourself again. And I'm a little flexible on the 3 minutes, but we want to keep it as close to 3 minutes as possible. Thank you.
Sorry about that. Okay, my name, Lori Banks, 63 Franklin Street. I'm a Geiger mom. Also happen to be a microbiology professor and work specifically in the areas of novel antiviral drug development. So this is sort of my wheelhouse. I just want to stress that while I do not envy the decision that you all have to make, and I understand there are a number of viewpoints that you have to consider, the science and the way that this virus does its thing and changes doesn't really, it's not concerned with other people's viewpoints and what we want to happen. I also don't love these masks. I like to wear lipstick and I can't, right? They're regular everyday things that affect everybody under these circumstances. But as it relates to how the virus replicates and who it affects and those kinds of things, that has absolutely nothing to do with where you're from, who you are, what you care about, none of that stuff. That being said, I think the minimum that we should be going back with is that people have to wear masks at the very minimum. We want people to get vaccinated. Statewide, I believe we are hovering right at about 60% or maybe 65, somewhere in that range. We need at least 80% of the total population to be vaccinated in order to start hitting herd immunity. Start hitting at 80%. Ideally, we'd like it 90% and above, as well as people become infected. So this is not to say that they would necessarily be symptomatic or have full-blown COVID-19 disease, but as individuals become infected, one cell that becomes infected creates about 1,000 progeny virus. Each of those, right, as they are replicated, has an opportunity to have some change in it. That's not to say that the change is going to make the virus more pathogenic, but there's a chance that it can. And those mutations happen in about 10% of all new viruses that come out of infected cells. The new viruses that come out then have about a 10-hour window to go on and infect other cells in people's bodies. And then the cycle starts all over again, where every time a new cell, not a new person, a new cell gets infected, about 10% of those are going to have some mutation that may make it more pathogenic, more infectious, something. So to say that there is little risk for staff members, associates, whatever that work in the schools or for the children is not accurate according to the data that we have on hand currently. I think the data are pretty clear on that. Again, while it would be ideal for people to be vaccinated so that we could keep the prevalence of the virus low in the community, that's not going to happen. We're not going to get to 80%. So with that, really the only thing that we have at our disposal currently is for people to wear masks. that's all I have. Thank you.
Thank you very much. Any other members in the public in person that would like to speak? Online, are there any online participants that would like to speak? Oh, I'm sorry, go ahead. Oh, no, push the button. The one with the face and the little thing coming out of it.
Thank you. My name is Sarah Pomelo. I live at 8 Elaine Avenue in Lewiston. I'm a parent of two now, because I have one who just graduated, two Lewiston Public School students, and I'm also a teacher at one of our schools. And so I guess I'm just going to speak as a parent first, but then as a teacher. Some of the feedback from my own children in terms of what school is like while wearing a mask. It was frustrating for them in terms of it was really quiet in their classes, they said. There was not a lot of interaction, whether it was from between teachers and students, like in groups or things like that, which obviously spacing also was a part of that. But just even socially, it was people were quiet, didn't want to talk. And some of that interaction for them was, or lack of it, I guess I should say, really affected their motivation to be a part of school. You know, and I think that there's certainly, there's always risks and medically for things, but there's also a lot of risk that I saw as a teacher, but also as a parent, in terms of how are our kids doing socially and emotionally, which is something that is very important to the district. And I think that is something that we can't push aside. I don't think it's less than. I saw in both of my own children, you know, some days that I wish I didn't have to see. So as a parent, sorry to get, as a teacher, I was not able to do some of the things I typically do. Small group work, discussions, I do literacy. So normally we have a lot of group work and group discussion. It's not that it can't happen, but it can't happen the same. If you are wearing a mask, you automatically feel like you're not supposed to talk or engage. I had very, very quiet classrooms, especially like, so one of my cohorts, I rarely ever, I would just want them to talk. And I know as a teacher, maybe you're thinking, don't you want a quiet classroom? No, I don't. I want students talking and engaging with me and with each other and supporting and helping each other learn. That was very difficult. Thankfully, last year, I didn't have a lot of discipline around masks. I also had a classroom of 10, 11 at the most. And I do think, I saw as the year went on, that got a little bit harder to be positive about. And I do foresee that with a classroom of more students and with time gone by, some of who have been in summer school, that if they're masks will be more of a problem, and I might be spending more time dealing with some of those discipline issues. We are asked to do a very important job, and that's educate our students. And I feel like the best way I can educate my students is to be able to interact and help them interact and engage about the content, about the curriculum with each other. Yeah, I guess I would ask for you to support the superintendent's proposal.
Thank you.
So I'm Jamie. I have my son Sam goes now, and my other son just graduated. I have a different, I want to vomit out my mouth because I got like different angles I want to roll on. I want to first start off with the masks. Absolutely not. They agree with that lady of they shelter you from being able to talk. They just don't want to talk. I'd pick up my nieces, faces red, can't breathe on the playground outside playing. It just does not work and nothing ever good came out of it. I would like to touch upon the vaccines that I got a phone call today promoting the vaccines. With the promoting of the vaccines, is there informed consent for the people taking the vaccines? Yes, go get your vaccine. We'll pick you up. We'll do this. We'll do that. We'll get you a school bag full of this and full of that. But are people being informed of the consequences of taking the said vaccine, of the dangers of taking it, of the consequences of taking it, of the deaths that have occurred, of the adverse reactions that have occurred? There's a website, VAERS, it's VAERS, which is the website for adverse reactions. Here's your Hannaford pass out for vaccines. This is your CVS one. This is your Walgreens one. And I got an extra one. And none of these pass outs does it say that anybody has died or can die from these vaccines. In the last, more people have died taking this one vaccine than all combined vaccines ever. That's an issue. When the Ebola vaccine came out, they stopped passing the vaccines out at the 25th death. We are now over 6,000 deaths, which the CDC just changed from last week to this week. They knocked down in half. You have the CDC director saying the new variant, the Delta variant. I spoke with the CDC myself. I have emailed them. I have talked to them. You cannot specifically test for the Delta variant. So how do you know it's the Delta variant? Right? There is, I don't know how much time I have left.
55 seconds.
55 seconds. So saying that the masks have graphene oxide in them, which are not good for the children. The vaccines should not be promoted. They should be informed consent. Now, these people are going to get their vaccines in hopes of a freaking lunch pail, a bag or whatever, but they need to be informed of the side effects of these things that are actually killing people. And to answer your question, 74% of the cases that are double vaccinated right now down in Massachusetts are the ones that are sick. The people that are getting sick right now as we speak are the double vaccinated, not the unvaccinated. So you shouldn't fear me, I should fear you. Thank you.
Thank you. I see that there's at least one hand raised online. We have another person coming up to the mic here in person. So we will get to your online hands shortly.
Good evening. My name is Allison Litton. I currently serve as the Lewiston Education Association President, as well as the Connors Elementary School Family Engagement Coordinator. I'm also the proud parent of 2 elementary age students within the Lewiston School District. I've had the opportunity to speak with Superintendent Langlis prior to his release of the proposed plan that you see tonight. I'm grateful for the opportunity to share my thoughts in this forum as well. I would like to begin by making it clear that I'm not here tonight to present data regarding educators' opinions on the masking matter. Admittedly, the informal feedback that I've received has been quite mixed. This is a very polarizing issue. Many individuals understandably are simply ready to put the pandemic and all that goes with it behind them, while others maintain caution and concern due to their own health and the health of loved ones in their care. My statements this evening, again, are those of my own as a Lewiston educator and a parent. As you likely know, on July 27th, the federal CDC, based on scientific data and analysis, publicly announced that they are recommending universal indoor masking for all teachers, staff, students, and visitors to schools, regardless of vaccination status. Subsequently, on July 28th, the state of Maine adopted the federal recommendations. At this time, I feel that the responsible decision for Lewiston Public Schools, as well as schools all around Maine, is to follow at minimum all recommendations from the medical experts at the federal CDC, as well as the Maine CDC. I personally am not willing to risk the level of liability that not doing so may open our organization up to. If a simple mask within confined spaces without social distancing, as you all have at your disposal tonight, will help protect my colleague's newborn baby or student's high-risk caregiver, I'm willing to make that small sacrifice throughout the course of my workday. A measure of our sense of community is clear in how we take care of one another. I recently read a quote about leadership that has stuck with me. The quote states, Leadership is not about being in charge. Leadership is about taking care of those in your charge. With that said, I urge you, as leaders in Lewiston, to do exactly that. Put your personal circumstances aside and think about others, particularly those in our care who have not yet had the opportunity to access the vaccine due to age or medical condition. My sons as well. As I have said publicly, I will stand behind and will advocate for in-person schooling for all Lewiston students. Last year was a rough one for all of us. Though it is evident that social distancing requirements will be particularly challenging in some of our educational settings, required continued masking offers a secondary barrier between all individuals in our care, students and employees alike. As recommendations shift due to changing conditions, as we all know they will, I sincerely hope that the leadership within Lewiston Public Schools continues to revise and reevaluate plans as to what is best for our school communities, as they were so committed to doing last school year, even when doing so caused social pressures and criticism. Committing to starting the 2021-2022 school year by following the federal recommendations sets our district up for the best case scenario and ensures the ability to keep all students and staff in person while the challenges of the pandemic continue. Thank you for your time and consideration.
Thank you. Are there any other members of the public that would like to speak here present? Nope. Not Karen, you want to add people in? Thank you.
Hi, thank you. Can you hear me?
Yes.
Thank you. So my name is Linda Scott. I live at 45 Pettingill Street. I've had 3 children that have graduated from Lewiston Public Schools, and I currently have 2 grandchildren that are in the process of getting ready to start school with Lewiston Public Schools. I just want to say that I absolutely support the superintendent's recommendations. I think that the superintendent has done a wonderful job in ensuring over the last year and a half, with everything that we've gone through, the best education for our kids and the best that we could have in the crazy situation that we have been in. I'd also like to state that I trust in Jake that when things change, and as he stated this evening that he is watching things regularly, that he will make the decision and bring forward a decision to you to change things if they need to happen. I'd also like to caution you that I find it very concerning when I hear an elected official say that they think that it should be required that students be vaccinated, required that students wear a mask, and it's not a parent's choice to make that medical decision. I find that very concerning, and I think you need to be very careful when you make a decision that should be a parent's choice. Always remember that your job is to provide policy and education, and the best education for our Lewiston students. Your job is not to make decisions for parents in a medical situation. I have a child that had to be vaccinated several times. I have issues with vaccinations for my child. We chose to make sure that our child had a great education in Lewiston Public Schools. And we knew in making that decision that she would be exposed to chickenpox, the measles, and everything else that she got inoculated with, and also came down with chickenpox 5 times, ended up in the hospital for a couple of years during her high school year, and had a very difficult time graduating. Those were decisions that my husband and I made for our child. And we knew the decision we were making. You need to trust that parents know the decisions that they need to make for their children. If they choose that their child needs to wear a mask, then they should have that choice. They are watching the news just like you. They are seeing everything that happens. Make sure you remember that it's the parent's choice and not your choice in what a child should be doing in their schools, especially a medical choice. Thank you.
Thank you, Linda.
Pam, you're free to speak. Can you hear me?
Yes.
My name is Pamela Rasmussen. I'm a speech pathologist at Montello Elementary School. And I agree with the proposal that Lewiston Public Schools should be on a regular schedule 5 days a week. And LPS staff are charged with educating students as well as keeping students safe at school. The Delta variant of COVID-19 is spreading in Maine. We have some counties in Maine at a high transmission rate of the Delta variant. This summer, we had a low daily rate of 14 cases. And on Thursday, July 29th, the daily rate was 120 cases in Maine. Children are getting sick and hospitalized with the Delta variant. Students younger than 12 cannot currently get vaccinated. Also, those of us who are vaccinated can get infected. The new research out is that vaccinated people who do get infected carry a high virus load that can infect other people. It is my personal opinion that staff and students should wear masks when students are present. If the school board decides to recommend not wearing masks for students and staff, I would advocate that this issue be addressed again if Androscoggin County becomes a county with high transmission. Thank you.
Thank you.
Donna, you're free to speak.
Thank you. Hi, can you hear me?
Yes.
Good, thank you. Hi, my name's Donna Olson. I teach social studies at Lewiston High School. Let me start by saying that I don't enjoy wearing a mask. Yet I'm vaccinated and I still will wear a mask because if I were to contract COVID-19, the Delta variant in particular, I may be asymptomatic, but I could still carry enough viral load to infect others as easily as it would be if I had chickenpox or the common cold. So I believe that a policy that leaves masks optional is misguided because it fundamentally ignores the reasons why we wear masks, right? My mask protects you from me. We can all agree no one likes to wear masks and it may even be uncomfortable for some, but it's a small sacrifice to make for the health and safety of others. CDC recommendations are based on science, while reasons for not wearing one can range from personal preference at best to misinformation at worst. Let's give Lewiston children and staff members an example of a community that prioritizes the greater good over self-interest. 5 out of 6 of my classes in the fall right now have between 22 and 27 students in my room. There's no space for the spacing that we had last year. They're not going to be physically distant from one another. So my question to you is, will Lewiston Public Schools do their best to protect them and the staff members who work with them? Or are we effectively going to be playing Russian roulette with the health and safety of the students and staff at our school? Thank you very much for your time and I appreciate your consideration.
Thank you. You don't see any other hands raised online? That's Donna who just finished speaking. All right, we will come back to the committee. Are there any committee members who would like to speak now? Member Butman.
So Jake, in the realm of what I spoke earlier about not failing as we go into this, I wonder what, as we start to assess how things go along, and we may have to quarantine, and we're not going to be offering online. Students are going to have to kind of catch up on their own. We may have cases where entire schools shut down. I mean, if this is going the way it's going, and I'm just referring to the reports of 95% of the people in hospitals are unvaccinated. If we're moving in that direction and we have all this, I asked a simple question. I guess my point of view is I think this is going to fail. And I just put it out there because we went through this last year. Yes, Maine was in the background for so how long, but it caught up to us. And as we watch something again coming up, it's going to catch up to us at some point in time. I think, where the federal government has taken the lead in mandatory vaccines, I think we'll have mandatory vaccines. I think we'll never mind mask. And I can't even think about mask right now. And I'm wondering why we're not getting vaccinated when we have at least a reasonable solution. It's not the solution, but a reasonable solution. Where are we with the state? Why is it that federal government is starting to lead? What are the other governments doing? What's the expectation here? And if there is no vaccine, I guess I would at least question the elementary schools where the younger children don't have the opportunity to get a vaccine. Are we kind of stopping short and at least having some safety in that population? Whereas our middle school and our high school, it's a reasonable number that have already begun vaccination. So I guess those two questions, if you could.
So my understanding is that why it's gone to federal versus state, I don't know. I think that's mostly political. That's my 2 cents. I'd like to stay out of that realm as much as possible tonight. But it is accurate that everything we're doing today is hinging off of federal guidelines and a state operating procedure that they've issued, which is comparable to last year, except the pool testing piece as a tool for mitigation and monitoring. Probably shouldn't use mitigation, use monitoring. So that's my answer, I guess, to why is it coming from this place versus the other, for your first question. For your second question, I've grappled with this repeatedly in my mind, especially around elementary kids, because under 12, you cannot be vaccinated. For better or worse, on a personal level, I've got a son that's 10. He has been all over creation this summer. You name it, Funtown, baseball tournaments, pool, friends over, at friends. And I don't know if I made the right decision, but he did all of that without a mask. But when he did it without a mask, I was the superintendent. It's 24/7, 365. I'm sitting at events. I'm watching people in restaurants, people at grocery stores, and I'm just trying to take it all in. And I see kids under 12 everywhere I go without a mask. And one of the things I struggle with is that my call to recommend, regardless of what your family thinks or feels, concerned about the public health, is that my call? And I know it's not ultimately, it's the school committee's decision on the policy, but there'll be, as you know, we can predict, there'll be responses this year. I don't know about schools closing. That will hinge on how many people are willing to be pool tested. If we have a big group of people that don't want to be pool tested, it will tie our hands if there's positives that pop up. We won't be able to have them in the building. We know there's some people that can't be vaccinated there's a few reasons, and they don't get to make certain choices because of those medical or underlying conditions that might prevent them from being vaccinated at any level, at any age. So that's the great debate. But when I watched kids doing all of these things this summer, it felt like early it was a gamble, almost felt risky. And then as the summer progressed, and even now with the Delta variant, I pulled up tonight, there was 6 or 7 kids playing basketball. On September 1st, when kids come to school, regardless of the decision of this school committee, short of us taking the rims off those hoops, there'll be 6 or 7 or more kids out there shooting hoops at all age levels without a mask after school as soon as they can pull them off. I'm not saying that's right. I just think it's a reality. So to restrict the learning environment on top of that, knowing that there's no mitigation elsewhere, unless mandates come down, People are still sitting in restaurants, large groupings of people. They're not spacing tables like they used to. I haven't been to Old Orchard, but I was watching the news the other morning, and at like 6:30 in the morning, there was all kinds of people already out walking the walk. I'm not saying I'm right. I'm not anti-science. In fact, I'm in favor of science. What I'm saying is there are realities to this, even under the age of 12. And if it means a better learning environment, and this is going to happen publicly outside of school, then that's a big part of how I landed at my recommendation. While also knowing as we ramp up to school, other schools in other parts of our country have already begun school. All of these recommendations could change between now and September 1st. We're very aware of that. But that's how I got to where I was.
Ms. Ray.
So again, I have another question. They're really coming fast and furious. So when in your recommendation, it says that mask wearing is a personal/family decision. Will we be tracking those decisions by parents? So if a 6-year-old comes to school and their parents would or their families would really like them to mask, but they rip it off, how are we managing that?
It's a great question, and it's been discussed. What I don't feel comfortable doing is asking our staff to follow kids around and say, your mom said, or your dad said, or even some families where mom and dad may not agree, which has happened, that we have to chase that. So it would really come down to just that decision to have it and to maintain it if this is the recommendation.
Given that response and everything we've heard tonight, I just want to remind everyone of I'm only 31, but I feel like I have a grandmother mind and soul, and just remind everyone of the saying, an ounce of prevention is worth a pound of cure. And I'm not willing to go as far as mandating vaccinations or tracking those even within our school system, but masks aren't a medical decision. A face covering is not an irreversible thing. I was very genuinely shocked when we stopped wearing them here, but as a vaccinated individual, I have chosen to test the strength of my vaccine here rather than continue to wear it and be the black sheep of the school committee for yet another reason. And so I just really think I agree with most of the stuff in here. I think it's really important to be in person 5 days a week. There are physical limitations to these buildings. It sounds like there's limitations to our staffing. I don't want our staff spending time doing contact tracing when we could have just had universal masking and maybe an ounce of prevention is all I'm asking for there. So if what is put forward is a motion to support this, I won't be able to because of that reason. If we're able to offer an amendment that mandates mask wearing, at the very least up through 8th grade, with the high school maybe having slightly different parameters based on their age, I could maybe go for that. But and I do want to say how much I appreciate the superintendent, the administrators, the teachers, and the families who are here and who have submitted recommendations and thoughts on this. It's every time we have this conversation, sorry kids out there, but it sucks like to make these decisions and have these conversations, but we're trying to do what's best for everyone. Not everyone has a family that's totally informed about what's going on. Not everyone has the option of getting the vaccine. And so I think that mask wearing would be what moves me, but I know other folks have different opinions.
Thank you. Any other comments? Mr. Majerus Collins.
So I guess I'll just make a motion that we require universal indoor masking for all teachers, staff, students, and visitors to all of our schools, regardless of vaccination status. And that's the exact language that the federal CDC has adopted and is recommending. And I would urge folks to support this. We've heard from a lot of informed folks, including astonishingly a microbiologist, which is great. You know, I think that we should listen to the science. I think we should proceed cautiously and proceed with respect to immunocompromised people and to people who don't yet have the ability to get the vaccine. So that's my motion.
I will give that a second.
Did you get that all, Jake? Okay, is there any further discussion on this motion? Ms. Ray?
Is it just that, or are we addressing the rest of the superintendent's recommendation?
Right now, it's just that.
So just for clarification, so you're proposing that there would be another amendment, another motion after to address the rest of the superintendent's proposal?
If someone wanted to make a motion to adopt the rest of the superintendent's proposal, then that would be their prerogative.
Okay, any further discussion? All votes start with Ward 4 tonight. Oh, yes, public comment on the motion on the table. Oh, Mike.
Allison Litton, LEA President, Family Engagement Coordinator at Connors Elementary, and parent of 2 Lewiston students. Just to touch on a few things before this goes to a decision, I'm hearing a lot of discussion about what's happening this summer. This summer is very different than what happens in school. I taught summer school this year for 3rd grade. I had a maximum of 10 students in my classroom. I had space to socially distance them as far apart as you all are at your tables. We had nobody that was sitting right next to each other. Masking was questionable in my opinion. Did turn out okay, even though we had quite a few students coming to school ill and being sent home. We had a few that were tested as well. And as I've learned, even with vaccinated individuals in my family, 2 out of 3 vaccinated, all 3 positive. This new strand is very different. The vaccine will allow you not to be hospitalized, but it's not going to allow you not to get sick. Just like wearing a seatbelt in a car will allow you not to die, but it's not 100% fail-proof if you get in a bad accident. So just something that we need to keep in mind. My students were in my classroom for a period of an hour at max. We switched classrooms. They went in pods. That's not going to be occurring during the school year. We spent a lot of time outside. We have a new beautiful garden. We utilize that for outdoor learning. We utilize that for lunch. We utilize the playground for recess and the field for activities. That's not going to happen in the middle of January or even October if we know Maine weather. A lot of the spaces that were discussed that have been observed this summer were outdoors. I heard maybe 10% restaurants and personal homes where there are individuals that are vaccinated. In a classroom, we may have 1 adult that's vaccinated and 24 unvaccinated students at the elementary level. That's a little bit of a different ratio than 50-50 or even vaccinated heads of households coming together for a barbecue outside. Family choice is a wonderful thing. We honor that in a lot of our schools for a lot of subjects. What happens outside of school for family choice is not our responsibility. At school, we hold students liable for a certain code of conduct. At home, parents may not. In the community, kids may not be following that as well. But again, that doesn't come back to a liability for us.
Thank you. Any other discussion? Mr. Bopelant? Oh, sorry, you go ahead, Jay, sorry. The face.
Got it. Hi, I'm Jay Rich. I am an ELL teacher at McMahon Elementary School. One of the strategies I use with students is called visualizing, and we talk about making a picture in our brain. So I would like you to visualize being in my pre-K and kindergarten ELL classrooms without a mask. It's beginning of school. Kids are sneezing on you. They go like this. They don't do this usually. They're 4 and 5. This is fine. They're coughing on you. They are licking things, you know, they're being a 4 or 5-year-old kid. And we teach them not to do that. However, that's a lot of germs. We're already spending a whole lot of time sanitizing our hands. We're going to be cleaning all of the tables as we normally do and as we did a lot last year. However, when you're working with students that age and they aren't able to be vaccinated, I think that it's very valuable for them to be masked. And I understand that there are a lot of parents here that are very that they really want all of their kids to be in school 5 days a week. And I do too. I don't like online learning. It is not fun for me either. However, if we want to do that, we need to be masking for a little while. And I will point to the state of Mississippi right now. They went back and did not vaccinate. And I'm reading an article now that a third school district closed their doors and are going back to remote learning. And they have over 800 people in quarantine. And I know that we are not Mississippi. We do not have the population they do. We have different vaccination rates. However, we don't want to get anywhere close to that. And we want to keep our kids in school. And if the best way to do that is to wear a mask for a little bit longer, then I say, let's do that. Let's keep our kids in school. Let's reduce the amount of bacteria coming my way and everybody else's way, and just wear it for a little bit longer. The kids are used to it. They did not put up as much of a fight really at all. It was just kind of pull it over your nose and they were good. And to the topic of them not being, I did not see that in my classroom. I teach ELL kids and we want them to talk a lot. And I did not see that being a problem. Yes, there was a little bit of a problem showing them how to make different sounds with your mouth, such as and d. However, there were different ways we could get around that, such as the clear mask. So I really, really, really encourage you as a teacher, as an educator, to please, at least in our elementary schools, I think that it would be smart to start that way, and we can always take it back. So, thank you.
Lori Banks, 63 Franklin Street again. I just wanted to point out, in addition to what the prior speaker said, I also taught in person this last year down the street, both laboratory classes where there's typically lots of hands-on stuff going on. Again, I'm a microbiology professor, so showing literally how you function a microscope is a difficult thing to do under normal circumstances. So it was definitely very awkward last year, but not something that was impossible, despite the fact that we all had masks on. I did also wear the clear masks in my classrooms, and that seems to work really well. Addressing the issue of how we're seeing the number of variants or mutations that we see, I just wanted to point out that as we increase the amount of activity that we have amongst unvaccinated folks, or even with vaccinated folks who can become infected, people who might be asymptomatic, whatever, that are carrying the virus on their person. The more contact that we have with the virus, the more it gets to sort of know us. So it's not a mistake, it's not happenstance that the mutation that we're currently seeing, there are 2 mutations that we're seeing, lie directly in the area where the virus binds to us. And it makes it a stronger interaction so that it's easier to become infected. That can happen also in parts of the virus that make it evil and hurt us. We haven't seen those yet, but as we give the virus opportunity to see us, to see our children, to see cancer patients, whatever, we're providing an opportunity for it to become informed and either infect us easier or kill us easier. So to say that we are not going to see it is not accurate. We're actually providing it space and opportunity to mutate and do what it does best, which is to become a more successful virus, successful meaning able to infect us and hurt us.
Thank you. Are there any participants online? Oh, sorry, go ahead. There's one more person in the audience. Nope, go ahead. Just turn the mic back on, please. Thank you.
Thank you. So just going back to the whole mask stuff, the Delta variant, like I said, if anybody that can read can look it up. There is no way to test for the Delta variant out of the words of the CDC themselves. They might put it on paper, but if you call and you talk to them and you ask the questions, there is no specific test for the Delta variant. Saying that, the FDA just nixed out the PCR test. I'm assuming the pooling test will be done through the PCRs, the swabs. Anybody aware that the FDA actually just stopped those and that they're done because they failed their test to actually be federally approved? And two, the vaccines are emergency use only, not federally approved, so it cannot be mandated at this point in time. So in the email today, it was worded as in same as traditional vaccines. It's not a traditional vaccine because the vaccines that we all voted on a couple of years ago that got mandated, that we had to have vaccines for school, this vaccine is not mandated. It is emergency use only, which will not be federally mandated. Anybody can look that up too. The pool testing, let's see, where are we at? Yeah, that's all I gotta say is people just need to educate themselves. I might not be her position. I might not be in anybody else's position. But I'm not a potato head. I can read and I've educated myself because this is very important. As we all need to look into this.
Thank you. Mr. Bobolop.
Yeah, this is a very tough issue and it's not a black and white one. After Miss Jamie's presentation last week, I'm sorry I didn't catch your last name. I called my son, who is a microbiologist, got his PhD there, went through the Lewiston Public School System. He works in Cambridge. Told him some of the bullet points that our speaker made, and he came back with 9 bibliographies for me to read from the Journal of American Medicine and the CDC on the importance of masks. Secondly, I have the unique position here, and I think some members of the public know this, and all of you folks know it, of being the only member here that has his boots on the ground. I have been a classroom teacher for 43 years across the river. And quite frankly, it was time to put me out to pasture. The COVID situation did it. The remote learning was not successful, satisfactory. It was the first year that I didn't have fun. I wore the mask. My students wore the mask. We did the best we can. And I strongly feel that if we're going to try to resume normalcy, to bring students back into the classroom, to dispel the facetious idea that remote worked. Yeah, it worked for the students that were wonderful in the classroom and had the go for it and go get it attitude. They did at home, but so many students disappeared. We won't rehash that. I know I want to keep this brief, but I do want to give my reasons on how I will vote. That I think it is a compromise. I certainly is, again, my son will have his soon to be 12-year-old vaccinated with his willing participation the day after he turns 12. He will wear the mask. He came up here on vacation, spent a week with us, wore the mask everywhere he went as a matter of doing business. And I credit him and his parents for that. Basically, I think it's a compromise that we have to make. I have gone on record strongly supporting Superintendent Langley. I have researched his points of view. I have very rarely questioned or vetoed some things, but with all due respect, I'm looking at the greater good here. And it's easy to say, well, look at what a hypocrite is. He's retired. And yes, I am. But I am going back as a substitute at Edward Little High School. The connections after 43 years there are not going to go away. And I will wear a mask. And I will bite the inside of my lip and not see the total visage of my students. I had to learn to read them by their eyes, and that's not always the best. The whole thing to get back to normal in the classroom is worth the price of a sacrifice of wearing a mask. And that is the reason I will be voting as I do. Thank you.
Thank you. Any other member, Majoros Collins?
this is just a quick point. I encourage folks to support this motion, obviously, and put it forward. But I do want to remind everyone that the language here that I've put forward and that comes directly from the federal CDC only requires masking indoors. So this is a slight departure from how things had been practiced to the best of my knowledge. And it also is a recognition, as some folks have noted, that people have been outside this summer and having fun and not wearing masks. And the reality is that this disease has far less transmission outdoors than it does indoors, which is why the federal CDC recommendations and why this motion only would require masking indoors and not everywhere.
For clarification of the motion, is this motion to require masking indoors or universally? I guess I want to make sure because
Universal indoor masking.
indoor only.
Yes.
That's the motion. Is that
Any other discussion? Oh, sorry, go ahead, Tanya.
I want to thank everybody who has spoke tonight, no matter what side you're on. This has been a really good conversation and debate. You know, I've had these same conversations at home between my husband and myself, and I really have to look at a lot of different aspects. I think we all have to. And one of the biggest things that I'm struggling with is teachers. If we say that no masks need to be worn, those teachers don't have a choice at that point to say, when you enter my classroom, you're going to wear a mask. That aspect right there to me is devastating. I had COVID, my husband had COVID, and we were very sick, and we still have symptoms. And this was back in January, February. So this isn't something to take lightly. So I'm struggling with this decision tonight, and I want everybody to understand that. But I think parents should be able to have a choice for what their kids do in the classroom and in school. But I think that teachers need a bigger choice. They're not allowed, even if they're vaccinated, you can still get COVID, it's showing, and maybe not as strong. I don't know all the details, but a teacher needs to be able to say, if you come in my classroom, you're masked, if that's their safety that they're worried about in their family. I'm not sure exactly how I want to vote as far as Mr. Majoris Collins's motion, but I want to say that my decision is going to have to be made with the teachers at the forefront.
Thank you. Ms. Hawkins?
So I've waited to say anything because I wanted to hear as much as I possibly could. I have my own opinions about all of this, like everybody does. I've shared this before and I'll share it again. My father got it in January and is still dealing with long-term consequences. My mother is 64 years old and is on breathing treatments for the first time in her life. Never needed any issue. No asthma, no bronchitis. I had chronic bronchitis when I was a kid, which made me very cautious with this going around. I'm vaccinated, but that doesn't mean I can't be a carrier. So that means every time I go into an enclosed space where I know there's not going to be enough spacing, I wear a mask. And it's not because I want to protect myself from COVID. I have a very close friend who's been a shut-in since all this started, because between her heart issues and her other health issues, it is just not safe for her to even go out of her house. She literally still wipes down groceries when they're dropped off with alcohol because she is so scared. If I was to be a carrier and pass this on and somebody else died, it would gut me. And that's what shocks me about a lot of the conversation I hear is, well, they could get it anywhere. Who says it came from me? Even if you don't know, that's still somebody who's gone. We've lost 600,000 people in this country. That's not a small number, no matter where it comes from. That's a lot of people that are just plain gone. And if I contributed to that, I would be gutted. So I choose to wear a mask. I think knowing that our smallest children who can get COVID, and we don't know that all of them get it horribly or all of them get a mild case. We don't know that, and we probably never will. But knowing that they're the most vulnerable right now, I think the least we could do is try to protect them, because that's our job as adults. Sorry. I spent a lot of time in the downtown with homeless people that I've become very close to. And I saw it. They spent all winter, most of COVID outdoors and didn't get sick. But when they went into shelters and people weren't masking or people weren't being tested properly, they got sick. I think the least we can do is expect people to be a little forward thinking when they're in a confined space and try to protect their neighbors and their neighbors' children. That's just my opinion.
Thank you, Mr. Potvin.
Jake, quick question, a little off topic. Is our medical department equipped and are they still offering vaccinations for both staff and the children?
There's an effort that's been ongoing, including coming up, not mandated by any stretch, but the Auburn site, which is a large mass throughput site, maintains good levels to have people vaccinated. Not on site because they're putting the resources there. That's part of why we tried to figure out how we could offer transportation for those who wish to go get vaccinated. Not that they wouldn't work with us in the fall should some approvals change or things like that.
Any other discussion? He's asked, he didn't have his mic on, but he asked to repeat the motion.
Okay. Member Potvin, the motion is to require universal indoor masking for all teachers, staff, students, and visitors to all of our schools, regardless of vaccination status.
You good? Okay. Before we go to vote, I just want to briefly put a little context to the way that I will be voting. I think that it's important to keep in mind that this process is a very fluid process, and it has been for the last year and a half. We have put plans in place, policies in place, and changed things, and then had to adjust those things with very short notice because everything in this situation changes so rapidly. One area of consistent feedback that we have received is that the students, parents, and staff do not want to wait till the last minute for a plan. So a plan that we put in place tonight sets the stage for everyone to begin to prepare for their return to school. And importantly, it respects personal choice and parental choice. I think that if the COVID cases continue to rise in our community and in our county, and we find ourselves in a different situation, that we can make adjustments as needed at that time, like we have done for the last year and a half. But I think that I am unable to support anything that takes away any kind of personal choice. I feel that optional masking and strongly encouraging people to wear masks and strongly encouraging people to get vaccinated, I think is definitely within our scope as a school committee and school administration. But I think anything more than that, we're taking away autonomy that everybody should have. And I can't endorse anything that takes away parental choice. So I will not be voting in favor of the amended motion because I can't support anything that takes away parent choice in this situation. Any other comments? Ms. Wright.
Just one last question to the superintendent, because obviously this would be a slight deviation from your plan. I just want to, where is it? Boop, boop, boop. Would we continue to provide and maintain the availability? Oh my gosh. Will masks still be available to everyone who needs them if it is mandated by vote of this board?
Yeah, we still have quite a supply, and we would get more as needed. We did find last year that a lot of people preferred to wear their own masks, which is good, but we know that we will have some that need them because they get dropped, they get soiled, they get forgotten wherever. You know, our students are still young, and there's those pieces. I can envision some other variables, like I got off the bus, and then from the bus to the building, I didn't have to wear it and I lost it. So we might consume more. The same groupings of people that will be close in proximity in their classroom would be in the same close proximity on the playground. So I could see we might have to look at picking up litter almost, because I can see kids, and I mean this with all due respect, kids walking out the door and just going because it's not mandated outdoors with this amendment. I would also ask, and I think this committee has been very supportive of me in other efforts, but one caveat I want to mention is the Maine Principals Association often comes up with their own guidelines for extracurricular activities. I'd like to maintain that we continue to do whatever it is that they advise, which might create some separation as it did last year. I just want to be upfront about that.
But in terms of equity and availability of masks, we will have them. Yes.
Yes.
Thank you.
Ms. Bowden?
I'm sorry, I just have to ask with this amendment, is this going to involve sports teams as well? Because, well, I mean, I have a basketball player
Indoor
and
sports.
it was absolutely miserable for that team to have to wear masks running up and down a court. And I can't support anything that's gonna put masks back on their face after not having to wear them all summer.
Yeah, you're spot on with that as being a pretty significant challenge, and extracurriculars are like a different layer of choice, whereas going to school is kind of less of a choice. But that was part of why I was saying out loud that we would follow the MPA guidelines around that. At least that is my anticipation, unless this committee wants to take different action. I don't know what the MPA guidelines are yet. They have not been released. We are waiting patiently for those.
So this motion that's on the table right now specifies all indoor activities. So are you saying that like indoor basketball would be excluded from this if this were to pass tonight?
I'm saying, depending what the MPA guidelines are, which we don't have yet, there could be guidelines that differentiate from this recommendation, but they would be extracurricular activities. In the past, we followed the MPA guidelines to a T very specifically. If the MPA says mass, it's mass. If they say not mass, then I guess I don't want to act like there's any gray area here with the committee, that we've been following the MPA guidelines. We've done so successfully with little illness and good strategy. And our athletic director, both the middle and high school, follow through very well. So if you ask me for a recommendation, I would say that we follow the MPA guidelines, but this discussion is about school and education kind of during the day. But
Okay, and then I have one other question. So if this were to pass today and then a student shows up at school and decides that they don't want to wear a mask, what would the repercussions be? How would that be enforced? Or a teacher for that matter. If anybody in our schools decides that they are vaccinated or whatever the case may be, and they decide that they do not want to wear a mask, then how would we enforce it as a school district?
I mean, the easy answer is we're going to say it's a policy. And the hardship is that this committee, and again, not just this decision, but 50 decisions over the last year, has made very hard decisions through good process. But whatever the policy decision is, we'll carry it forward. However, I would say short of, you get into those, you have to validate your reason why you cannot. If that doesn't fall within valid reasons, we might have to have tough conversations where we explain why we want you to have a mask on if this is what's approved. But ultimately, if the student refuses, it would be a violation of policy to attend without a mask.
So we ultimately might be refusing to provide education to students that we're required to provide education to if they decide they don't want to wear masks.
I mean, as I say here right now, I would say yes, for lots of reasons.
That feels like a slippery slope also. Yes, Member Majerus Collins.
So to address the two issues that were just raised, so that there's not any question or uncertainty going forward in future adoption and implementation of this were it to be passed tonight. As the author of the motion and with the consent of the person seconding the motion, this is in reference to mandatory basic education. And so if there are sporting events that are going on during the school day indoors, then they would be covered by this policy. If they're going on after school hours, if they're going on in a non-Lewiston Public School location, if it's a separate thing from the regular school day, then this policy doesn't cover that. And then it falls under whatever the MPA is requiring and whatever our schools are requiring. My understanding is that most sporting events don't happen during school day for obvious reasons. And so I wouldn't think that this policy would catch that a lot. In terms of what happens if somebody doesn't want to wear a mask and they refuse to wear a mask, we've just spent a school year imposing a mask mandate. And this would just be a continuation of what we've done for the last year. So however we've handled it for the last year strikes me as an appropriate way to handle it going forward. I think it's interesting that there are members of this committee who did not raise objections to masks over the last school year, and now a proposal that would simply continue that policy going forward with greater in-person attendance is being sort of portrayed as some undue infringement on personal choice. I do wonder where that objection was over the last school year.
Last year, there were alternatives. If a parent didn't want their child masked, they could homeschool, they could remote school. There were alternatives last year that are not available now. So last year they had multiple options, multiple avenues for education. And this year their option is come to school with what you're presenting, or come to school and wear a mask, or you're not getting an education. That's the difference between a year ago and now. Member Potvin.
Yes, I'd like to make a motion to amend the amendment to change it to K through 6 only, mandatory masking.
Is there any discussion on, is there a second on that?
I will second.
I would like to speak on that. I think that if we are only making mandatory masking in certain grades, there's a variety of age groups in each grade. So we might have fully vaccinated kids who are 12 and older who are still in 6th grade. So that changes it. At the middle school, there's a very wide range of ages from like 11 to 14 sometimes at the middle school. So that we end up in a gray area of where we vaccinating are we requiring masks of kids who aren't even eligible to be vaccinated, or vice versa. There was a lot of strong language used tonight about how things were unfair, there was injustice, these ideas were radical and absurd. And so I think that a proposal where we're only requiring half of the district, it falls into that category, because if it is unfair for us to if it's unfair for us to have students going to school masked or unmasked and having that choice, splitting it in the district, it just amplifies that even worse. So I don't know that that's the solution. Ms. Ray.
And just going to start with a clarification. There is not, what the original motion is not an amendment. It is its own separate main motion. So this is just an amendment to the main motion. Putting that aside, I really respect that Member Potvin tries to come at these things from a place of compromise, and I believe that's what this is. But I will not be able to support it because I think it just doesn't pass the test of, we don't have the time or the resources to keep track of vaccinations. We don't have the time or the resources to spend time on contact tracing and quarantining and that sort of stuff. And so the effort to mask indoors while folks are required to be in school learning, these students, that's all I'm trying to get to. If that motion fails, then we have more options to consider, but I don't unfortunately see that the K to 6 would be sufficient in this model. So I will vote against that.
For the sake of clarification, even if we do have a universal masking policy, there still will be contact tracing and quarantining, correct? So if we don't have those resources, I mean, we need those resources regardless, no matter how we move forward. Those things will continue to happen.
Yes, I would agree. And looking at the language, the biggest tool right now looks to be that pool testing, and followed up by now testing, which is that constant monitoring approach.
Member Majerus Collins.
I also respect where Member Potvin is coming from on this, and were his amendment to my motion to be successful, I would still support the main motion amended. But I do think that the best thing for us to do is to follow the CDC guidelines. The guidelines are clear, the guidelines are unambiguous, the guidelines cover K to 12 schools. And so I think that we are on the safest ground from a public health standpoint, and frankly, from a liability standpoint, if we follow the best available guidance from the federal CDC. And unfortunately, that means that Member Poppen's amendment should be rejected.
Member Damon,
I'd like to move the motion to vote.
so do you want to reread his, just so we know what we're voting on right now?
Yeah, we'd be voting on the amendment, which is to require universal masking indoors for grades up to grade 6.
Point of order, once someone makes a motion to move the question, we have to vote on that motion now.
That's what we're doing.
We have to vote on his moving the question.
Okay, so we're going to vote on whether or not we are going to vote. All right,
Yes.
Ward 4, Ward 5,
Yes.
Ward 6,
Yes.
7. Could you turn your mic on, please? Thank you.
No.
Ward, City Council,
No.
yes. Ward 1,
Yes.
Ward 2,
I'm sorry, we're voting.
whether or
On-
not we're going to vote on Ron's amended motion. With no further discussion. We're voting to end
Yes.
discussion, basically.
Yes.
Okay. And Ward 2. 3, no, 2, 3.
No.
Motion passes 5-3.
So we will now be voting on.
Is that an adequate amount?
There's 9 of us, so that's not
Sorry.
possible.
6-3. My apologies.
Then that is adequate to move forward on the amendment.
That Superintendent Lingless just stated a moment ago. Ward 4,
No.
5,
No.
6,
Yes.
7,
No.
City Council.
No.
No. Ward 1,
No.
Ward 2,
No.
Ward 3.
No.
Any further discussion before we vote on the original motion? Ms. Hawkins.
I believe in your memo, Jake, you had said that the state does have resources for students to school remotely at home. The state has resources for students who choose to homeschool?
The state does have resources to homeschool. However, I want to be clear and upfront that they are resources for teaching and learning. They are not teachers provided. But they've done some good work to develop things that can be used for teaching and learning, but they don't provide teacher in that sense. There are some other opportunities like Connections Academy, but that is not elementary level. Is it
7.
7 up?
Yep.
7.
Well, is there any limit to if a student comes in one day and doesn't want to wear their mask, getting their assignments from their teachers before they return home? Are we not giving them that option?
I know that we're going to work to make sure that students have a device if they need it, because we have a lot of resources now that we didn't have last year at this time. And that teachers are working to have work available there. But again, not that teaching and learning commitment that we've been able to have in remote settings in the past.
So there would still be opportunities for education, but they would require a little bit more flexibility or commitment, self-guidance.
Yeah, it would be, realistically, teachers would only be providing the work that they have provided the students they have in front of them. And again, kind of like having the flu in years past where you have the work that you need to do, but we don't have a teacher interfacing in that sense. Not that some teachers wouldn't, check in or what have you, but as far as I can log on at 8 and have my teacher with me all day, we do not have the resources to do that in this model.
Thank you.
And how would that interface with our truancy policies? If a student just consistently doesn't come to school but picks up their work, at some point that falls under truancy?
It would.
Any further discussion before we vote on the original motion? Ward 4,
No.
Ward 5,
Yes.
6,
No.
7,
Yes.
City Council.
Yes.
No. Ward 1,
No.
Ward 2,
No.
Ward 3.
Yes.
Motion fails 4-5.
Thank you. Member Potvin,
Madam Chair, I want to make a motion to accept the presentation by Superintendent Langlis as presented.
is there a second
Yes, there
second.
is.
by either one of you? Member Majerus Collins. I can come back to you if you're not ready.
Well, I have a question for Member Potvin. Member Potvin, were a more narrow masking amendment to be offered, would your position change? Or would we expect a similar outcome on a vote with a narrower masking policy?
Are you negotiating his vote with him?
Yeah, no, what I'm trying to find, I want to offer an amendment that does a version of what I just said that we were going to do, but it lost 4-5. So unless one of the people who voted with the 5 is willing to switch, there's no point in having the vote again. Member Potvin offered an amendment to my motion, which failed, which was a narrower version of the masking policy. My question now to him is whether if a comparable motion were to be put forward, would he support it?
I want to move to vote on what Member Potvin just brought up.
Ward 4, would you like to move to vote and end discussion?
I mean, honestly, the public's already been able to weigh in like 2 or 3 times on this subject matter already. I don't know what else needs to be discussed. So I'm gonna stick with my motion that we vote, please.
Is there a second on that motion?
It doesn't require a second.
Yes.
Ward
A
5,
point of order, a question for the parliamentarian. Does a motion to move the question require a second?
we didn't have a second when Member Damon just motioned to move the vote. It doesn't require a second.
It
So I said
might,
yes.
but no one asked me during that period of
So,
time, so I would
Before
have
we
to
look it up,
So my
was there a
question now
second,
is-
just in
There was
case?
not a second.
I know before, but I
There was
thought
not
I,
a second to his and there has not been a second to hers. No.
So my vote is yes. I'm voting to move the vote.
Okay, but there's a standing parliamentary question here, so.
Well, when it doesn't, no. We didn't do this last time, so just because it doesn't benefit you now,
The precedent
that's
has
not
been set
okay.
at the very least for tonight,
I-
so we're
I'm-
going to move
I'm
forward.
appealing the ruling of the chair, and I want to vote on whether second is required, or someone can just provide a second.
To my knowledge, a second is not required for a move the vote. It takes precedent over all other motions, but if the parliamentarian wants to look that up, while I look it up, she may be able to find it quicker.
Is it easier just to second the motion?
Would you like to
Is
second?
there
I'll second the motion.
Okay, great. Ward 4,
Yes, for the third time.
Ward 5,
Yes.
6,
Yes.
7,
Yes.
City Council,
No.
yes. Ward 1,
Yes.
Ward 2,
Yes.
Ward 3.
No,
motion passes 7-2.
We are now voting on Member Potvin's motion to suggest, accept the I can't speak, I apologize. To accept the recommendations as the superintendent put forward at the start of this meeting. Ward 4,
No.
Ward 5,
Yes.
Ward 6,
Yes.
Ward 7. Your mic's already on.
Thank you. I remember that quote I used before from Genghis Khan, only a fool would fight a battle he can't win. But in the spirit of democracy, no.
City Council,
No.
yes. Ward 1,
Yes.
Ward 2,
Yes.
Ward 3.
no,
Motion passes 5-4.
Thank you. All right. Thank you, everybody, for your participation tonight.
You want to read what was voted on against, because there was so much confusion?
Yeah, a review of it.
So a quick review of the recommendation. 1 second. That mask wearing is optional as a personal and family decision. We do recommend you wear a mask if you're unvaccinated, and that language could shift. And then the couple of notations that Staff will continue with routines with electronic platforms if students need to access that, but we will not be providing remote instruction due to staffing resources. Contact tracing, quarantine, all of those will continue as guided by the state. The Lewiston Public Schools will be doing pool testing, and we're still getting all the details on that. And that we, by this recommendation, for the superintendent to make decisions as the situation changes without having a school committee meeting, although we may have school committee meetings to discuss components of the plan. But that would allow us to react in real time if situations change. And also an emphasis that if the guidelines change, they're not mandatory, that they'll be assessed, but doesn't necessarily mean there'll be a change. If guidelines change and they are mandatory, we will absolutely follow the requirements.
Thank you. Agenda item.
Request for a
number-
5-minute recess.
Yes, unless anyone is opposed, we can take a 10-minute break. Okay, we are on break. We are live and, all right. Agenda item number 6 is to receive, discuss, and possibly vote on the local delegate to the MSBA Annual Delegate Assembly. Superintendent Langless, I'm assuming, is going to present. I didn't look at the.
Yeah, just real quickly, referring to an email that I received, but we annually designate someone to go to the MSBA conference and fall activities to represent, but also to take in information for Lewiston Public Schools. And we typically, as part of that delegate assembly, have an alternate or a second person if they're showing a vested interest in that work. I believe last year it was member Majerus Collins and member Hawkins that attended, and there was a vested interest that they both go. And I believe that they did attend virtually.
And this year's delegate assembly is scheduled for Saturday, October 23rd at 9:30 a.m. Member Majerus Collins.
I don't know if we're entertaining motions, but I would make a motion to appoint Linnea Hawkins as our representative. She was the alternate last year, and I think that she'd do a great job representing Lewis Public Schools this year.
Second. Member Hawkins, are you available on Saturday, October 23rd at 9:30 a.m.?
I can be. I'll have to pacify a teenager, but yeah.
Is there any discussion? Miss Ray?
I didn't know we were going to be making motions so quickly, but I just want to thank Ms. Hawkins for going last year, learning the ropes and being ready to go this year. I think you're a great representative of Lewiston, so thank you.
Ms. Whitlow?
Yeah, I was just curious if anybody else had interest in doing it. No, Janet, no?
I don't even know.
So it's usually a lot more interesting when it's in person, but doing it remotely, it's a lot less involvement. We can speak to what it's like in person, but I think that only Kieran and Linnea can speak to what it's like doing it remotely.
Okay, so I thought it was worth doing, and I thought it was important for Lewiston's voice to be there because Lewiston is a school district that is unlike a lot of other school districts in the state. I made a point of raising issues of equity, specifically racial equity, which is not something that many school districts are dealing with in sort of a material way in the state of Maine. But in terms of like its value to me as a board member or as a human who learned things, I wouldn't say that it was an overwhelmingly valuable experience in that regard, just because it was remote and it was kind of difficult to. And then the other thing is that, a lot of these people have been going to this conference for like 30 years and they all know each other. And so I guess what I would say is I'm glad that I went because Lewiston was represented. I'm glad that member Hawkins went because Lewiston was represented, but I wouldn't say that it's a particularly useful thing to do for like personal boardsmanship growth, at least as long as it's going to be remote.
It's we probably should specify, it's the Maine School Board Association. And it's an annual conference that they hold every year. And normally when it's in person, there's a whole slate of different events that you can attend throughout the day. So you can get presentations on a wide variety of different information. And then the delegate serves to vote on anything that might need to brought to the state level, and then anything that might need to be decided upon at that time.
Okay, no, I think Linnea would be a great representative, and quite honestly, I have 2 teenagers involved in soccer in the fall, and I cannot see a weekend free. So yeah, I'm totally on board with Linnea.
It is going to be virtual again.
Yes.
Thank God. Still don't have the van on the road. Please alternate anybody, just in case.
Member Beauplan, you should do it.
I feel like we were all standing in line to ask for volunteers and everybody backed up and I'm still staying here.
It's a wonderful experience. You'll love it.
Yeah. Now that I'm retired, I have loads of free time before my wife books me for something else. I'd be happy to be an alternate. Thank you.
And
If
can
voted.
we,
Without objection, can I amend the motion to make member Beauplan the alternate as well?
all right, any other discussion? Ward 4,
Yes.
5,
Yes.
6,
Yes.
7,
Yes.
City Council?
Yes.
Yes. Ward 1,
Yes.
Ward 2,
Yes.
Ward 3.
Yes.
Thank you.
Motion passes 9-0.
Agenda item number 7, to receive a presentation on the ER3 COVID relief grant, and Ms. Derrigan will be presenting.
Well, Jenny makes her way up to the podium. I actually got a picture last week from Sue Williams. There was an invoice that was being submitted to one of the CRF grants. And just to give you an idea of the amount of work it takes, the printouts, the packets, the specificity, and the itemizing of those grants covered tables, including these two, the entire table. That was one submission for one part of one of the relief funds. 2 tables, stacks this high. So Jenny, thank you and your group for all your work.
It's true. That really did happen. My apologies for not getting a few of the resources or the items that I'm going to be using today to the school committee in time for the packet, but I have posted them on the website. So they're up on our district website. Right on the front page, there's a button to click called ESER fund information, this one right here. And that has a few of the things I'll be referencing tonight.
Jenny, real quick before you go, just as an FYI, we mention ESER funds and ask people if they have input at various stages of our community forums. We had another one last week. We had one a week or 2 prior to that. And we have our next one coming up. The plan right now is after the personnel agenda on the 16th for the school committee to jump into a community forum after that. So we continue to have those community forums to try to answer questions and get input on things from reopening to relief funds and mission, vision, goals, all of that. So input gathering at this point, just wanted to share.
Thank you, Jake. So yes, tonight I'm here to speak on the ESER 3 grant. It is the one COVID grant that requires some specific meaningful us to meet meaningful consultation requirements and also public comment. So that brings me here to discuss the work for this grant. It's very difficult to talk about ESER 3 just as an isolated grant because we're working with so many different COVID grants and different funding sources. So I will be talking about a little bit of the big picture, and then I'm trying to focus in on ESER 3 and what's included in that specific grant. But ESERF does stand for Elementary and Secondary School Emergency Relief Fund. And all the funds that we have received, well, if we can think of ESER as the umbrella, all the funds are falling underneath, passed by different acts or law. So the goal for today is to review COVID funding for Lewiston Public Schools. I have information on the amounts of funding and on the timelines. To share COVID relief needs assessment. So I wanted to share out how some determinations for use of funds have been made and who's been involved and how that worked. Share the priorities and the goals for the ESER 3 COVID grant, because again, specifically that grant has the requirement to be very, to involve community response and reflection and review and collect that comment. And again, to offer public comment. On the website, there is a button that will bring you to a Google form where you can share comments. And that's actually live and ready to go right now. So Congress passed 3 stimulus bills, and in total it was over $190 billion. And those funds were all for ESER, all for education across the nation. All of the funds we're asked to use them to respond to the issues, of course, directly aligned to responding to COVID-19. When a bill is passed in the Senate, like the CARES Act or the CARISA Act, some people are calling the second one CARISA Act, and the ARP Act, those become law. Once they're passed by the Senate and the House and get to the president, it's signed, the bill is signed and it becomes law, and which is a little bit interchangeable with the word act. So the CARES Act was the first act that was passed that brought funds to ESER. That was back on March 27, 2020. And in that first round of funding, We received opportunity to apply for a day program grant called Day Program CRF, Adult Education CRF, a District 1 CRF, which was a pre-K to 12 grant, a District 2 CRF, again, pre-K to 12, and the ESER 1 grant. So all of those specific grants that really function individually were all part of the CARES Act and the first sort of wave of funding that Lewiston Public School received. Soon after, December 27th, 2020, a second round of funding came. And so this one is called the Coronavirus Response and Relief Supplemental Appropriations Act. And we applied for and received, or we are applying for and going to be receiving ESER 2. And then finally, most recently, March 11th, we have funding called ESER 3, ARP 1 homeless, and ARP 2 homeless. All the grants on this list that you see here are formula grants. So Lewiston has received an allocation amount besides the one starred grant here, which was competitive. Oops, sorry. ARP 1 was a competitive grant, and we had to have been already participating as a receiver of McKinney-Vento. So, and we are. So we put together a request for use of funds for McKinney 1 or ARP 1, excuse me. Here is the breakdown of funding for Lewiston Public Schools. I'll give you a minute to digest some of these numbers. So the first wave, oops, oh, I guess I can't hover over, sorry about that. COVID McKinney, CRF day programming, adult ed CRF, CRF 1, CRF 2, and ESER 1. So the top, is that 6 on the top? Those were the first grants that we were planning for, working with, doing a needs assessment for, and the use of funds were reported out in the January spending report that Karen brought to the school committee that had a detailed needs assessment, the process of how we just determined how to use those funds, and again, how the funds were being spent. Those grants are all closed with the exception of ESER 1 at this time. So CRFs were the grants that were originally only for a very short period of time, and we worked really diligently within the district, all the planning teams and all the building principals and stakeholder teams, just to gather information quickly and get what we needed by December 30th. And then once we hit that time frame, it was actually extended to June 30th. So very recently, those grants have come to a close, and we're moving to our next wave of funding. ESER, so as we move down to the ESER 2 grant, ESER 2 and 3 are our largest grants that we've received for COVID response thus far. These grants have been in the planning stage for many months now. We are going to discuss both of those tonight. So ESER 2 and ESER 3, because they're so large, we had to really look at those grants for planning as almost as one whole grant, but at the end of the day, we need to submit 2 of them. And certain costs are going to fall in one grant and certain costs are going to fall in the other grant. And we just had to really figure that out to best serve Lewiston. So you'll hear more details about that tonight. Any questions about those before I go to ARP? ARP 1 and ARP 2 are grants and funding that are going to allow us to enhance our already established homeless programming and services to identified McKinney-Vento kiddos in Lewiston. $196,000 for ARP 1 is incredible. We're going to be able to do some really amazing work there. And again, in addition to what's already established. And ARP 2 is to be determined because we are going to be receiving a formula amount for that second one, which again, will be able to just be bringing more services to kids and more support to our schools and our community through those 2 grants. The amount that I'm expecting for ARP 2 is about $400,000. So that's unlike what we've ever received before to serve our community.
in that way. And lastly, our learning management systems grant was just a little opportunity that we in Lewiston had to pay for our learning management systems, whichever ones we were choosing to use for the next 3 years. And so Seesaw and Google Educator or Google Workplace for our grades 7th through 12th, I believe, or 4th through 12th. For the Google Workplace. And so that grant is paying for those 2 platforms for 3 years for us, which was so awesome opportunity. So I guess I wanted, before I dove into this next slide, Lewiston is taking every opportunity to apply and receive funds, whether those are allocation and formula driven funding options for us or competitive. There has been nothing that has been pushed out by Maine DOE that we have not actively pursued. So right now, since our first wave of CRF funds have closed, yes, like Jake said, we're invoicing. So that's a huge project that's happening, but we're ready to move on into the second wave. So you're going to hear ESER over and over again, ESER 1, ESER 2, and ESER 3. They all came from different acts. They all serve in the same way in response and recovery from COVID-19. They have a different timeline, however. ESER 1 is going to be available to us through September 30th, 2022. ESER 2 through September 30th, 2023, and ESER 3, September 30th, 2024. So it gives us a very nice kind of exiting out of COVID funding. And I know that there's been a lot of discussion around this room in regards to how we're going to be tackling some of those financial pieces. So there's been 3 main considerations during the planning process and the use and just determining what we needed to use funds for at this time. One being the framework for reopening schools and our reentry plan that drives how we need to respond and get kids back into school buildings and return to in-person instruction. And so those have guided decisions about use of funds. We also have conducted district need assessment for all of our COVID grants. And so we're using our family surveys, our staff surveys, our student surveys, our public forums that Jake is putting on. So that work continues. A district needs assessment is also driven by the data that we've collected over the last year and a half. In particular, for an example, our average daily attendance. We took a snapshot of average daily attendance from 2019-20 and compared it to 2021. And as a district, our attendance had decreased by 7.1%. And so with the data, we're able to say, this is something we need to respond to. We're going to use funds in this way. And what you'll see tonight, and I'm sure here throughout the next year, is that we have individuals or hiring individuals to work at schools to really heavily support attendance, engagement, truancy, and pieces around that nature. And sorry, last on this list is to bridge local budget shortfalls for FY22. And so those are the cuts that we were allowed to use ESER funds to cover from our local budget that are critical and essential to running schools. And so we have a large amount of locally cut cost on ESER grants at this time. So for ESER, again, ESER 2 and ESER 3 were built together. So this is an important part. So we had 9 million and we had 20 million. The ESER 2 grant is very, very school level heavy for the type of expenses that are landing on ESER 2. And ESER 3 is, of course, it serves schools in many different capacities, but it's definitely more of a department heavy grant, which has our technology, our facilities, our nutrition programs, adult ed, LRTC, just many of the pieces that aren't our pre-K to 12 schools. So it worked out that management and that split worked for preparing our grant applications. Our priorities here are, we have many goals, many priorities, many things that really rise to the top that we need to attend to. If we're looking at how we're spending our funds, opening schools safely and all the pieces that are required to do that, we have a large amount of ESER funds going to be used for that work. Providing remedial student supports, again, a large sum to do that work, and to provide educational technology supports. And I'll talk a little bit more about those pieces. So for safely opening schools, some of the expenses that are currently planned for on either the ESER 2 or ESER 3 grant are our air quality projects. And those are happening at, I didn't put that note there, but I know Josh is here. I believe it's LHS, LMS, McMahon, and some other district buildings need upgrades to some ventilation pieces to meet requirements of air quality.
Jenny, just 1 second.
Yeah, go ahead.
Without belaboring the conversation, we've also tried to be very strategic, and we've talked with our finance committee about this. We are trying to make sure the backbone of our infrastructure can last longer than COVID. So when we talk about air quality projects or these items in priority 1, we're talking to the tunes of double-digit millions that we're investing in our facilities around these funds.
Absolutely. Generator projects we have at several of our school buildings, and I believe the central office as well is still on our plans for use of funds, and flooring replacement projects, window replacement projects, accommodating new teaching and learning spaces, and storage, which really equates to the Connex boxes that you see around the district and our continued need and use of those items. Priority 2 for providing remedial support to students. We're really looking to address any learning loss brought on by COVID and to fill gaps. We are hiring additional academic, or plan to hire additional academic interventionists using ESER funds. There are, between academic and SEL intervention and supports in school buildings pre-K to 12, we are budgeting and planning for 42 positions in all. ESER funds will be paying for summer programs. Actually, this very summer, 2021, is being paid by ESER 3. We were allowed to use funding prior to full grant approval with just our ESER 3 grant. It was very specific to just that one grant. So we made sure we could do that and support our community as needed. So summer programs for 2021, 2022, and 2023, after school programs for the next 2 years. LRTC teachers and student instructional materials, adult ed pathway counselor, coordinator, and some extension of programs offered at adult ed, and many professional learning opportunities.
Just a little bit of a plug. That pathway for diploma is something that for many years we've struggled to make that connection with adult education. Right now, having been down about 300 students, give or take, in our district, especially at the upper level, finding ways to bridge those gaps to make sure that the students, if they've already stepped away, or if they're going to step away, that they have a direct pathway through other supports in our district to get their diploma in a different way.
Important to note for priority two, there's a requirement of the grant that we must spend a minimum of 20% of our funding on remedial supports. We've met that and gone above and beyond that requirement. Priority three, providing educational technology supports. And the reason that this priority is heavy with, again, cost is our tech infrastructure projects to ensure that our buildings and our community can access learning and with the increased use of users and all of those pieces. I know Dave could speak more eloquently on that, but that is a large cost for ESER 3 and so has become to show as one of our priorities. Our student learning platforms that we've used over the last year and a half, we will continue to fund. We need to keep those things going to support teachers and students and all the different learning environments we may find ourselves in over the next several years. ClassLink is a single sign-on that we're bringing into Lewiston this year to help streamline logging in for parents and students. Additional student devices, cases, and other items needed to replace, repair, replace lost devices, or just need to upgrade to a device that's working effectively. So there's funds in there for those situations. We have interactive projector project to complete that had begun in CRF funding, and we still have some work to do to complete that project. So we are continuing to use funds in that way. And professional learning as well in the areas of technology. So if you are curious and want to know where to learn a little bit more about the ESER funding, I really recommend the main DOE site. I have a few links at the end of the slide presentation, and it is on the website, so you could just go right in there and click on them. I picked the few that I thought were really informative. And then also, just to reiterate, on the LPS website, there's that blue button on the front homepage where you can tap and go to the items I presented tonight and also offer public comment. You'll find a summary for the use of funds that's more detailed than the slides I showed today. So if you're looking for a little bit more detail, you can look there first, and then you're welcome to contact me.
Ms. Wright?
Of course, just thank you for all of this work. I can't imagine sorting through continually shifting guidelines and federal paperwork. Just one note, I had clicked into this on the LPS website. I don't think the PDF version of the presentation is available quite yet for folks.
We'll take a double look at that. Thank you. Might be an access.
Member
piece.
Madeiros Collins?
Okay.
I just wanted to also thank you for all the work that went into this and for all that you're doing to make sure that we're handling this stuff properly. It's I mean, I knew intellectually that the third relief package provided a big boost to us, but seeing the numbers right there and the massive amount of support that we just received from the federal government is striking and makes me feel like we're in a decent position going forward. So thank you.
I just want to say, Jenny hates this public recognition, but every one of those grants that you saw up on the screen has different rules, different places where they reside, different application processes, different approval processes, different invoicing rules. And I was very pleased, but also sad at one point when they had the 2 tables worth of invoices, they sent them to the state and they wanted them broken down to another level. So it was like 1/8 of a quarter versus 1/4 of the quarter. She could probably correct me, but it had to be resorted. And when you're talking about volumes of work like that, I think she was mad for about a minute and then they just got to work. And the other thing that I think is important for you to understand is this amount of money changes how things leverage with the city. Because we're a municipality, we're allowed to spend some things, but without certain approvals, we extend the credit of our city a great deal. So we typically operate at about $100 million a year between title funds and approved budget, about $100 million. With this latest round of packages, we're operating between 140 and $150 million. So I just want people to understand that the volume of the work that Karen has led, but also through Jenny and Sue, who's behind us, and Peg, who's helping now, and our finance department that at the beginning actually reported to us that we can't take this on. Someone else is going to have to help. And the curriculum department took it on and took it head on. And then more money came in and then more money. I swear we were just figuring out CRF1 and all the rules around it when we were up to CRF3. And so, Jenny, I thank you publicly for all the work that you and the folks you work with have done. It's changed the lives of our students and our community.
Ms. Hawkins?
Before you hop down out of there, I just want to say really quickly, as a member of the finance committee and seeing so many numbers, my eyes cross sometimes. I really appreciate how clearly you laid this out for us. I look forward to seeing it up in PDF form so I can go back over it and remind myself of, oh my God, more numbers. I just went through a mini grant process with my own organization running one small grant. Kudos. We should be sending you muffins and ice cream, honestly. Thank you so much for heading up this, Karen and the curriculum team for stepping in to help, because this funding is going to keep the school going for a bit. And hopefully it'll help the community understand that this funding is just keeping us floating. It's not necessarily patching any of the massive holes that we've been dealing with for a long time. So really appreciate the work you've done helping us get through this. Seriously, muffins and ice cream if I could.
Thank you,
Thank
Jenny.
you very much.
Agenda item number 8, social emotional learning ruler presentation.
So I'm going to share my screen. I also want to start by saying that this work doesn't happen without Aisha Hall, who couldn't be here tonight. She hasn't gone anywhere, but she couldn't be here tonight. But we agreed that it was really important that we get something up in front of you and also our community around the work that we're doing for a few reasons. One is, I'm going to try to do this at the same time, but one reason is that it's really important to us to make sure that we're making these connections for social emotional learning. And I want to start to build out some of that for you, but also for those listening or who might pick it up later. But also with the ESSER funds, or the relief funds, I like to call them because they've got so many names. But with the relief funds, we're looking at bringing on, as Jenny said, 42 roughly people are trying to fill those spots. Not all teachers, not all ed techs, but different resources. We have groups of staff right now that are going out into the community wearing Lewiston Public Schools outreach t-shirts and passing out resources to kids who haven't had a home in the last year and trying to get them to sign back up for school. This is happening every day right now. It's powerful. It's a big ask, but it's something that we need to do. We continue to do work at Longley to get that prepared for student resources and get those enrichments out. Josh has worked hard to get those contractors who are quite busy to work down there, but it's getting there. But when we talk about SEL and those positions, we talk about bringing in so many things: restorative practices, just a different approach, equity, you name it. All of these different components, they all kind of filter back to social emotional learning and the way in which we want to go about our business as a school system to ensure that we are helping students grow in a place where they can go into the workforce or whatever's after high school for them with a diploma, but with a skill set so they can navigate the world. But I don't want to mislead you that we're not trying to do this work, because we are very much doing and trying to continue to do this work, and it has many components. So I put up here part one. I didn't want to rush through everything and give Aisha nothing to share. She's got some really powerful things to share, and she's done a lot of really powerful work. So there'll be a part two to this. We'll look at a future agenda item to get a part two up here. There might even be a part three, but we want to make sure we keep you up to date with SEL and equity work and the things that we're doing as a district. So I'm starting with a question or a set of questions. Do we drive emotions as individuals, as people? Do we drive emotions, or do they drive us? Do emotions drive behaviors or drive thoughts? I can tell you that the way I was raised, there were some emotions involved in my parents, the way they drove me, if you will. And I mean that, but you knew when to stay away from mom, when to stay away from dad, when to ask mom, when to not ask mom. We knew these things. We learned to navigate our lives because of the emotions that we pick up on from other people. And there's different research out there in the work that we're trying to do now. It's being springboarded by the pandemic to make sure we can re-enter school in a way that feels safe and supported, that actually is safe and supported, but it's all rooted in this theory around emotional intelligence. So just to talk about the work a little bit, restorative practices, social emotional learning, equity, and other emotion-based work goes back many years. These include grant-supported efforts at Montello when they got the SIG grant. That's almost a decade ago, for those of you who've been around for a while. But restorative practice is part of the approach at LMS. I remember doing restorative practices training with Lewiston Middle School staff my first year on that site. That was, again, I'm dating myself, but that was many years ago. District-wide work, we've contracted with Restorative Justice Institute of Maine for several years. I would say as many as 5 years, to do work around training people about approaches. We have deans in place that are there to help mitigate sending kids home so that there's more time and capacity to build relationships and help kids grow their skill set and return to class. We have coordinators in buildings. We're growing that capacity. We have Aisha as a district level coordinator. Shifting disciplinary strategies, running circles, training students how to do circles, which happened at the high school a few years ago. Seeds of Peace, growing that commitment so kids can go off to camp to learn how to facilitate conversations. Work with our community collaborators that are doing the same kind of work, and many others that continue today. So the Yale Center for Emotional Intelligence, this route goes back to 1987. There was a couple of folks from Yale that built a program, and then right now it's really run by Dr. Mark Brackett, who, if you look him up online, you'll see lots of videos and presentations and resources, what have you. But the Yale Center for Emotional Intelligence was created after that 1987 conversation, and the research that they're doing now continues today, but they also have products and things like that. So when you hear about Ruler and Mood Meter and Castle, it's all connected back to this link of work. So EQ or IQ. So a lot of people talk about IQ and how smart someone is. And Daniel Goleman, years ago, 1995, put out this book, and this is actually a picture of the 10-year centennial, the 10-year anniversary of it. It's a different version. But this book was a game changer. It was used in education, it was used in business, but some of the best people that we know truly understand other people and their emotions and how to navigate that and how to get the best out of them. So how can we know others really well and be successful with the emotional intelligence or the emotional quotient instead of, without knowing ourselves and how we regulate ourselves? So I'm tying this to work expectations. Show up on time, work hard, be a learner, have good customer service, treat people well. None of these things get done without emotional intelligence and skills. So we talk about Ruler and Mood Meter. These are tools and constructs for improvement, and they're built off the idea that we are these things. We're better when we are in control of our emotions. We're able to learn about our emotions and emotional intelligence. That we're better when we're able to develop skills and strategies. That we can learn to imagine ourselves as our best self. I'm going to talk about something here in a few minutes. It's called a meta moment. And that's that point of real frustration when you're ready to lose it, or maybe even just prior to that, when you've been triggered and you're not at your baseline, that you can imagine your best self to not do that next thing that's really bad. And that could be a fight. That could be smaller. That could be not following directions, misuse of your pass. How do you in that moment get to a place where you can say, if I can imagine my best self, I might make a different decision right now that might keep me safe, keep me engaged with school, keep me on the right path. We want all of our kids to have that skill. And then also that we can de-escalate and lift ourselves and others up. So when you can find that best self piece, how do you spread that amongst your social group, your classroom, your team, your future? And then keeping the pandemic in mind, the need for reconnecting and accelerating is critical. So I took actual pictures from my phone from a slideshow from Mark Brackett years ago, because I thought they best captured what I wanted to share tonight. Not all the slides, but just some. So emotions matter. And this is research driven, and they're coming to find that attention, memory, learning, decision-making, relationship quality, physical and mental health, and everyday effectiveness. Even tonight, moments like the decisions that were happening tonight for you all as a board, different abilities with emotion allowed you to come to a place of success. And we can see dysfunction. We know what it looks like when we see it. And all of these components benefit from having stable emotions and understanding what they're about. But they did the research on not just suppressing the emotion, but actually understanding where you're at and being deliberate about it. So we're building some local data. This is not our local data. This is just a slide. But how do students feel at school? Well, they did this like across the country back in 2015, 2016. This was the net result. That the top 10 emotions named, 75% of them were negative, 23 were positive, and a very small percent were neutral. And I would argue with the teenage mind, neutral means negative. No kids here. Right? And we talk about what we want students to feel: happy, excited, energized, inspired. All these words, we want students to feel that way. But these words didn't just come from what adults think we want from kids. This came from students who said, this is what I want to feel when I'm at school. When I said we're building our local data set, I was in Panorama today. Karen had to help me with my login because I couldn't find it. But Panorama is a web-based social, emotional learning and wellness platform where we can actually have students answer some quick surveys, and we can actually get a level set by grade, by school, in comparison, where are people at? And we talk about how we close the gap, and that's what this is about. So we take an emotions matter mindset, that's social emotional learning. We pair that with emotional intelligence and work around positive emotional climate. That takes a lot of work, especially in the midst of a pandemic where people are up and down and anxious about health and wellness and safety and others. But when we can do those things, we find increased engagement, relationships, increased better health, better decisions, and certainly an increase in academic performance. The term ruler, I shared in a document that I sent to all of you as part of the packet, but ruler is recognizing, understanding, labeling, expressing, and regulating emotion. So I'm gonna stop talking for a moment, but I'm gonna ask a question first. When was the last time you paused in your day and did that? Because the truth is we don't. Most of us do not. We don't stop to formally recognize our emotions, understand them, label them, grow our vocabulary with them, express them to others in a healthy way, and ultimately regulate our emotion. Too often we don't do this. So we need to practice. This is a mood meter. You've seen these around our district if you've been in and about in the last couple of years. These are not new. We have adopted them. We put LPS on the side. We've worked with Yale to do some of this work. But really this meter is around, you can see the X and Y axis there, energy and pleasantness. And so without using words or emojis or anything, I'm gonna guess most of the people in the room right now are somewhere near midway to the bottom, maybe slightly left, which is a little unpleasant and a little low energy. I'm making that assumption because of the time of night, our minds are saturated, tomorrow's a new day, and it's getting late. And so I'm making that assumption. Like it's not a given. But you can probably guess what red is, or extreme red, or extreme yellow, or extreme green. Without words, without pictures, just colors. So we grow our terminology. We take time in our day to ask students, where are you at? How do you feel? And we start with, what's your pleasantness? We explain that to them so they understand what that means. I'm extremely pleasant, or I'm pretty unpleasant right now. What's your energy? High energy, low energy. And you can see how the words help build in a context. And what Yale is arguing is that as we grow students' vocabulary around these words, and by students, I mean anyone willing to learn, even adults, you can get better at identifying where you're at. And just that little piece can change the way you approach a situation. So how? From an education perspective, we make the time to take the time. We build in supports. We have professional learning opportunities for our staff, but we take the time with kids to do it too, as part of our routines. And we're going to grow these and continue to do these. But there's other pieces: persuasive writing, debating, creative writing, and you can see the other items up there. But demonstrating empathy on the lower left side, I thought to be an interesting thing, at least for me, kind of resonated with that. That if you go into that space, but you can demonstrate empathy, it's a whole lot different than repressing and getting angry, which can happen pretty quickly, as you know. All right, so from suspensions to skill building. This is that meta moment I talked about, and I like this little graphic. So top left is number one. Something happens. You can see how the something happened to that person, and the graphic is pretty simple, but it explains it well. Number two, you sense that thing, and there's a brain and a heart. So when you sense that thing, where did it land for you? Is it both areas? Did one trigger the other? You start to learn these things about yourself and how you feel, but also, as it comes up, when you hit three, it's that physiological thing. I spent a lot of work in therapeutic foster care settings prior to getting into education, as many of you know, but we worked mostly in that two area, that sense. So when you're really angry, do your hands get tight? Do your shoulders get tense? Do you get headaches? Do you tap your feet? Do you tap your arms? Do you flip things? Do you snap knuckles? Do you hit things? What physically do you do as you start to get upset? Or when you're really upset? Because if you can't recognize those things, you can't stop them. So when you recognize them and you can label them and you know if it's your head or your heart or both, and you can communicate with others because you have the words to use to do it, hopefully number three, you can stop. At a minimum, stop and think. Number four, be your best self, or you see your best self. Kids, I would argue, struggle to see their best self. When we talk about self-esteem and emotional regulation, kids are very quick to be more critical of themselves than anyone around them. So to build your best self or see your best self, it takes work. It takes commitment. And then we build student strategies. What are some other things you could do? How do you mitigate where you're at to de-escalate, to get back to a place where, again, when you're at your baseline and de-escalated, you're ready to learn. If you're not there, you're somewhere in one or two, maybe even three, but it's hard to learn when you have that sense and ultimately succeed. I know those graphics are a little lower level, but I would say that works for me some days, because we have to sense it and stop it and think of our best self and think about the outcomes and be predictive and do the best that we can. That's the meta moment. And then there's the solve problems of the blueprint. This is something you can teach kids and also adults. I would actually dare you to put this in front of family members at like a gathering of some sort. It could be interesting, but the ruler skills are on the left, and then there's the me person and how you get to we. So how do your behaviors impact others? Many years ago, I had it pounded into me that consideration is one of the best qualities we could have. Just to be considerate of others, think about different angles, truly think about those perspectives. This blueprint, I think, tries to teach students to be that. So when you are disruptive in class, you might have missed step 3 where you stopped and used the tools that you have or see your best self. But what does that mean to everybody else in the room? How does that impact them? And our teachers are doing this work every day. This just more formalizes it. Our goal, obviously, to be the big words on this chart, again, generated by students. Compassionate being number 1. So when we return to school, we must, this is not just SEL, but we must prioritize relationships. I've said this to our management team, and I know they're sending letters out to staff if they haven't already, and communicating this very thing, that when we return to school, we're prioritizing relationships. We're going to welcome our students and families back, establish routines, and get to know each other again. We're not just going to run out of the plane sprinting. We need to avoid the race of being caught up in a day after 18 months of interruption. We can't just jump on the academic train and pretend we're going to make it better by October. That's not real. That's undue stress on the kids. It's undue stress on the adults. That's not real. And we have to remember how hard things have been and how valuable our educators are. And if you didn't do something with a student and you're at home, I'm an educator. My wife is an educator. My wife is, I think, way better than I am. Teaching your own children is hard. And that's as an educator. When you're not an educator, it's even more difficult. Very challenging. We value our teachers, what they bring to the table, and we have to remember, we just had an 18-month interruption. Our teachers are coming off of not enough of a break, I would argue, and going back into situations that, again, are going to have anxiety, kids wondering, parents wondering, teachers wondering, all of that. We got to take care of each other. So we have to focus on that work. Next time, I want to work with Aisha to make sure we're sharing process with Panorama and how we're gathering student data. I want to continue to do so. So it's informing our practice. What the data is telling us about students and where they're at, which could be really critical this fall and throughout the year. Explore the ladder of inference, which is a process around decision-making, how people get to certain places, and share sample resources for students and staff, just to give you an idea of what some of these SEL efforts are doing. And that's the end. Is there any questions anyone may have?
Ms. Hawkins?
First, I want to thank you very much for presenting this because it's something we talk about a lot, but I don't think a lot of people understand. So this was really enlightening. Second, can I get a copy of this presentation? Because it was awesome. And I just want to share a little bit of an anecdote. When my son was 4, I was misdiagnosed with a mental illness. And he and I both went through a seriously disruptive point in our lives. He was 3 going on 4 and would throw full blown. He would have bounced his head off this floor. The fits were so bad. And he would go from completely calm to bashing his head on a concrete floor with no warning, no what's bringing it on, none of it. And I went through a process very similar to the 6 steps you had up there with him. We went so far as see a little puppet with a mama and baby bear to have him acted out because it was easier for him to say baby bear felt than to own it himself. And that's at 4 or 5 years old. Not every parent has the resources to do that, which is why this education here in our schools is so important, because it's our job as parents and educators to foster our children to their best ability. And that's emotional too. I think this curriculum can do a lot to help so many people in our community that want to be their best self, but don't know how. So we're teaching the next generation, and hopefully that generation can lead by example some of their elders to hop on that train a little bit and learn a thing or two. Because my time in the tree streets, I see so many people that this isn't even on their radar. They don't understand. So when their kids come home and talk about, well, I had a meta moment, their parents have no idea what we're talking about. So I really appreciate this presentation. I hope more people can see it and really, oh, wow, that's really cool. And step in instead of, well, I don't want to be any part of that.
Thank you. Any other discussion? Questions? All right. Thank you, Jake. Agenda item number 9, to receive and approve the second reading of the following policies. Are we going to do these all in one lump, or do they need to be done individually?
So
I was looking at you. I thought you would know, but I'll look at
I should
Jake.
say, well, I could just, I guess, start it, but Alicia, I believe, and I know that these did not require any significant changes. And so a second read was pretty straightforward. If the committee wanted to approve all of them at once, I believe they could.
Okay, thank you.
I'd make a motion to just approve all of them at once then.
Is there a second?
Second.
Member Majerus Collins.
I just wanted to ask a clarifying question of Member Ray. Is some of this the just tightening up of policy language to comply with previous expulsion standards? That's what we're talking about here?
All of the policies, ACAA, JIC, JICK, JICK-R, JICK-E3, JKE, and JICH are all in reference to previous ordinance or policy passed by this committee about taking out the option for expulsion at the elementary level, except where it needs to occur by state or federal statute.
Okay, I just was clarifying and yeah, thanks.
Thank you. Any other discussion? Ward 4,
Yes.
Ward 5,
Yes.
6,
Yes.
7,
Yes.
City Council?
Yes.
Yes. Ward 1,
Yes.
Ward 2,
Yes.
Ward 3.
Yes.
Thank you.
Motion passes 9-0. And while tonight was pretty late, I want to thank Member Ray for all her work on policy throughout the year.
Agenda item number 10, to receive subcommittee updates. We will start with Member Potvin on the Finance Committee.
Okay, so we've had a pretty eventful couple weeks and we made some milestones. And I think it all started, if you recollect, during our budget discussions. There were quite a few areas where there were a lot of questions that didn't seem to clarify themselves. And the subcommittee recommended that a forensic audit of the school department's budget be made to give us the feeling that we're on the right platform moving forward before anything else comes and hits us financially. So we wanted a really, really clear picture. And through the amazing work of the superintendent, administration, and the finance division, they completed the audit and there were findings. And so immediately, I guess I will say, we had a discrepancy of about $1.3 million in the audit. Kind of boxing this up, it's sort of a case where during the year, as we're adding things on our votes and looking to expand either positions or programs, something was being missed along the way to add it into the budget. So the budget that was voted on by us and the public approved was 1.3 million less than what we're actually spending. So we talked over a lot of different options with Jake in terms of what to present to the committee, how to address this. Obviously, there's not a magical 1.3 million sitting out there. So there's several options available. And right now, Jake is in the process with staff in reviewing what would be the more likely. I don't know if you want to talk about it now or wait till you have full concrete. So.
I mean, I can speak to it some. I think that I think doing the internal forensic review was a very important step. We also were able to go into the ESSER funds and look for those cyclical things that we talked about that, okay, would we need that the year after the relief fund start? Do we need that 2 years after? Is that 3 years? Is that 5 years? So we're able to look at those funds. But some of the things that we were able to identify and correct included, one example was massive healthcare cuts, but not across the spectrum in one particular article that should have been spread amongst the articles. And some of that bulk reduction work does happen, but it was in error by a very, very large amount. There's some other things that we found too, where throughout the budget process, some items were added with votes by the committee and placed in that budget area and article. And then when we moved them to ESERF, or the committee decided, after feedback from the city council, to make some reductions, What we came to find is they were never actually inserted, but that they were redacted. And so you had articles that have built-in numbers. For example, let's say there was $100 in a spot, and you approved something that cost $10, that area should go up to 110. It was never put up to 110, but then when the redaction was made, $10 was taken out, so it actually became 90. So the thing we had before for $100, we can't afford. And so we have some mitigation strategies that include, we're fortunate to have increased funding from the state connected to that 55%. And with your recent shifts, which I believe puts us in a well-positioned place holistically, and the errors that we found, we are in good shape. But other mitigation strategies could include freezing a budget early, looking at other relief funds to keep things moving in the right direction. And I anticipate this year being a much more a much better process from a budget planning and accuracy perspective.
Ms. Hawkins.
I just want to mention really quickly, I can be a numbers person, but the numbers we're dealing with here, I've said before, are completely out of my normal realm of what numbers are. Jake and Karen and Stephanie have been really amazing at walking the finance committee through this, what the plans are, how we're going to sort things out. It's been incredibly valuable to me because it really clarified where the ground floor actually is and where we're going. The effort put forth by those three people specifically, Karen and Jake and Stephanie, to help us find that ground floor and make sense of what's where and why, I can't say enough. That in itself, I have full faith in Jake and Karen and Stephanie that this is not something to be afraid of. We know how to get out. We know what our plans are for dealing with it. And that's what myself and I think our constituents in Lewiston need to hear. There is a plan. We know what we're doing. It'll be okay.
Thank you. Mr. Boland.
I'd like to give a here to those comments, but also to recognize Member Potvin, who has a eye, ear, nose taste for detail, the specifics, that can ask the hard questions, but also brings out good solutions that seem to make sense. Again, the budget is over my head. I am looking and listening and learning from a man that knows what's going on. So thank you.
Ms. Ray.
I think I have two questions. I'll start with the first. Was the forensic audit part of our regular audit process, or was there an additional expenditure for this?
Neither. Karen, Stephanie, and I locked ourselves in a conference room and went line by line through our budget. And between the knowledge that she has, the knowledge that I have, and the knowledge that Stephanie has, we were able to itemize these items, think of numbers that made sense from prior conversations, backtrack, match it, find the right article, move it. It was days and days. That was round one. And then Stephanie actually went in and made the edits that we had identified and corrections. And that took her days and days. And we're real close to actually rolling out the budget so that everybody else has access to it. We want to make the corrections first because it's harder to do after than it is before. Karen, I don't know if you want to add, that document is 483 pages, front and back. Yes.
So it was tedious, it was a lot of work, but I would say, and I said this to the finance committee, if anything, I really know that budget. And I think Jake really knows that budget, and Stephanie does as well. And through this budget process, prior to the vote and all of that, we were getting back to a place where we were adding more detail rather than just lines with money and not really knowing what that detail was. So having that detail there was helpful to sort of go back, jog our memory, and go back to votes that you had taken and those types of things. So it was a lot of work. I appreciate the kind words, but I will say in the end, coming up on the other end of it, I feel like we really know what's in that budget, and to be able, when someone says, how are we paying for this? I know how we're paying for it, because I know exactly where it is in that budget. So I just add that.
And I just want to add to, we didn't find misuse. It was the way in which it was cataloged by article, and we had to make adjustments for accuracy purposes. And in the process, we found omissions, inaccurate entries, things of that nature.
My second question was going to be if the document would be public, but it sounds like that. So I'll change it to like, are you guys okay after that? That sounds miserable.
Member Majoris Collins.
Member Potvin, thank you for bringing this forward to us and to our attention. What or who would you attribute this rather large error in our budget to?
I think if you just think back during the year, we had significant transition in our finance office. And anytime you have transition, you have missing moments in a time where a full budget presentation was in the process. Mix in a little bit of COVID to it, mix in a little bit of people that weren't able to get certain things done by certain timelines. The timeline we had, it just, it felt wrong. It felt wrong from the very start. And, once everything's been cleared and now we have a whole new team in place, to address it, I thought it was appropriate that, that the audit made sense at this point. And so as far as what added to it, I think it's just mainly the transition we were experiencing. Oh, keep in mind, we were shorthanded also in finance and we had not filled those positions. So between being shorthanded and then the transition, there was some areas where lines weren't added up right, or something wasn't added or something not deleted, and here we are.
Do we feel confident that this is an error that is exclusive to our most recent budget? Have there been any deeper investigations into previous year budgets, perhaps budgets prepared under the same personnel as the budget that we're talking about right now?
We haven't done a forensic look at that. I think the current fiscal year was challenged enough. We are dependent upon the audit that's done externally, I think from the prior year, and looking at carryover, which is to the right side of the line in the black from the prior fiscal years. Now, do I think that the work could be done? It's possible. I don't know if it's a good use of time. And some of the information that you find draws on conversations and people's memory in the moment. And so Karen's really good with themes. I'm pretty good with numbers. So when we see a number like $37,000, it triggers a thought for me. She often remembers what that was. I usually remember the specific day. It's a little weird. But to go back beyond that, I wouldn't have that lived experience to draw random numbers out of to connect the dots.
So you're talking about mostly changes that the committee made to the budget that were not added. I mean, is that basically what we're talking about?
I would say it's a little more complex than that. Some things in the wrong places, some things added, some major redactions that didn't land in the right article. And I think that's what Member Potvin was referring to when he talked about numbers that you approved that then went to city, that then went to referendum. Some of those land in an interesting place, and we're navigating that currently. And part of the plan we've talked about with the finance committee and our work is as we get into the school year, making sure we have a good pulse on that number, because it may be something we have to bring back to you from a transaction perspective once we get the books up and running, or they're already running, but a little further into the budget, because some of the corrections may actually land big enough to bring to you for approval. So we think that we're on the cusp of that. I want to see how some things play out, but that may be before you again. I would say anytime between mid-fall and mid-year. or it'll be okay because of the way it's working out. COVID plays into that a lot.
Any other discussion? Great, thank you. Next, it will be Member Damon presenting for the Facilities Committee.
Yeah, I don't really have anything to report, but Jake may.
Kind of circling the wagons from a prior conversation. We've met with or had conversations ongoing with an organization called Regeneron. And this is the process by which you can contribute to a solar array and then you get credits back. And long and short of it, we've updated our CMP billing information with them and they've issued us a new contract to consider. I did share that with legal to have them give it a look. Because it all hinges on credits. That's connected to state government at this point in time. There are energy savings credits that can be issued if you're producing energy in a non carbon footprint sort of way, or as much of a carbon footprint sort of way. The power wouldn't come here. We would be investing in the grid being built, and the energy that grid creates gives us credit, which reduces our bill. My concern, one of the reasons I went to legal was, one, the language of the contract to the tune of could be $100,000 a year or $112,000 a year commitment, but also because the way these credits function by way of the government, I want to ensure that a change in policy or a change in administration doesn't then make the credits a moot point, which means we would eat that savings every year because we would still be responsible to pay the bill to the investors for putting in the solar array. So a little bit of a wraparound, but just so you know, that may be before you if we feel good about that and the contribution. I know Member Majerus Collins has said numerous times about how we can get better with our carbon footprint or our impact, that we should consider it. So I just want to make sure it doesn't put us in a negative if it doesn't play out the way we think it might. But that would come before you for approval prior to that going anywhere else.
Member Majerus Collins, Curriculum Committee.
We have no report.
Thank you. Policy Committee, Ms. Ray.
You saw it all tonight.
Thank you. And then Ms. Whitlow for negotiations.
Just that we're in negotiations with the certified professionals contract.
Thank you. Agenda item number 11, report from City Council Representative.
Just a quick little update. We meet tomorrow night for our August meeting, but it looks like we might have another meeting coming up. We are receiving the final report from the Charter Review Committee. It's lengthy, so that's available on the city's website. Additionally, we are seeing a lot of permits for outdoor entertainment, so lots of things available. And then also, just to keep you guys in the loop, the Maine 200 Bicentennial Parade is still on for August 21st of this year, and that will be coming through Lewiston. So a really great opportunity to gather and be in community then.
Thank you. Number 12 is report from School Committee Chair. The only thing I have to report on is that this weekend, Member Whitlow and I attended the premiere of Zamzam's movie, Everything Earned. This is the third movie she's produced as a Lewiston Public School student, and it was amazing. I don't know a lot about basketball. I don't follow basketball, but I know a lot about passion and everything from the work that she put into that, and then the students that were being filmed, and Coach Turner. It was just passion. That's all. I walked away just feeling the passion from it, and it was amazing. So if anyone has the opportunity to see that, I highly recommend it. It was great. That's all I have. Agenda item number 13 is report from Superintendent.
I guess I'm going to piggyback on that. I recall during the pandemic as principal of the high school, Zamzam reaching out to me in a panic that she needed her equipment to edit the video so she could turn it in for a grade. And I remember thinking then, and I still do now, think that we have to find ways for kids with extraordinary talents to explore that deeper and not be checking boxes. Because the idea that she needed that equipment to do work was fine with me, but the idea that she needed it to turn in an assignment for an art class was silly to me because she had already been impacting our community with her art form for 5 years. And so I think she could defend that on a whim. So not getting into an academic record or anything, but she's obviously brilliant and couldn't be more proud of her work. Other than that, I've talked a lot tonight, so I'm gonna stop.
Thank you. Agenda item number 14, school committee community announcements. Ms. Hawkins.
Just want to mention again, I do this every week. I know the fence at the corner of Bartlett and Pine is complete. So if you know some kids that need a place to go and throw a frisbee or play soccer with a fenced in place where it's not going to roll out in the road, the fence is ready. So feel free. We haven't leveled it off yet, so mind your running, you might trip, but it's there and ready for use. As a reminder, I am at the PUG, the pop-up garden, 1 to 3 every Thursday. So if you want to come out and interact with the community, or the place you work is looking to spread some word about something, come on down.
Thank you. Any other community announcements? Agenda item number 15, future agenda items. Seeing none.
I noticed something in our calendar today and I reached out to Chair Parks about it. Our next meeting is August 16th. And it was put in our calendars as an hour. The following meeting is on the 23rd, which is also put in for 1 hour. I would like to make the 23rd a regular meeting. I think that was an error on entry. If there's no objection to the committee, the 16th would be for personnel, so we can get them up and running. And the 23rd would be a full meeting instead of what looks like in our calendar in our invite calendar, 2 personnel meetings.
And we'll still have the workshop on the 16th.
Yes, yeah. a workshop.
So that's workshop and personnel on the 16th and a full meeting on the 23rd?
Yes, that's okay with everyone.
I would just say the PDF calendar on the LPS website is then incorrect for every scenario you just described.
The document and what we've been sending out for invites, including the community forum and what's in our our electronic calendars is what we discovered today as being an error. So we can do the full meeting on the 16th if that's what the group wishes. The 23rd may be better for work prep and whatnot.
Everybody looks like they're okay with it. All right. Agenda item number 16, to enter into executive session to discuss a personnel matter in accordance with MRSA 4016A.
So moved.
Second.
Seconded by member Damon without his microphone on.
Yes.
Thank you. Ward 5.
Yes.
6,
Yes.
7,
Yes.
city council.
Yes.
Yes. Ward 1,
Yes.
2,
Yes.
3.
Yes.
Thank you. School committee will enter executive session at 9:01 PM.